hardware, software, all sorts of things we have experience, and as well as domain knowledge in healthcare. And we take all those things and we make a sort of a hacking kind of environment. It's an all-day affair, basically, on Saturday on the fourth floor that we do. And overall, in the last several weeks, we have been doing, on average, about 3 to 4 projects, discussing, taking the entrepreneur through the steps of how to build things. On the Mondays, we have a course here, which is a business planning course. This is basically how to write a business plan in a new way, not the traditional way. And you will know more about it as we go. So this is a lecture format kind of course. I'll talk about what I mean by that in a minute. On Wednesdays, Kalyan teaches a course on digital marketing. It is about the Google Analytics, search engine optimization, how to do metadata, and how to understand how the customer relates, social networking. All these things are done, and all these things he touches upon. On Tuesdays, we have in this room again, after Wednesday meetings also in this room, we have team building and jobs forum. Basically, people are looking for jobs who can come in and we talk to each other and try to help out. It's just a course that is just started. So essentially, if you look at it, in entrepreneurship, the most important thing is team. Okay, the entrepreneur has an idea. Before you do anything else, build a team of people who are interested in that, who can help you crystallize the idea, take it forward. So team is the central. As you know, if you're going to the investor, they're going to say, who's on your team? The team becomes the crucial thing for everybody to rally around and make sure that you don't go out of step. And all of our effort is to help the team, build a team. The entrepreneur comes in, once they get the idea shared and understood, our focus consistently is how do we get other people into the team, make a cohesive working team which has good chemistry among it, and they can move forward. Finally, the Wisdom Net is a program that one of the people who came here, entrepreneur, who wanted to offer a program called Wisdom Net, which is more motivational kind of stuff. And this is one of the things that we do. People, any of you guys, if you have something to teach and you want to share with other people, we can provide you space and we can make arrangements for you so that you can, set up a class and teach and get your feedback and whatever. So the Wisdom Net is a program that we allow another person to give the class and do that. So that's one way for those people, for those entrepreneurs who have something to share via teaching, this will be a good way to try it out and practice and see if they can do it. So these are the kind of things that we do. And as I said, this is a teaching lecture format, and also at the same time, this is a method by which you can develop business plan. Now, we have people who will be continuously doing it over a period of time, as well as people who are coming in new every time. So to adjust for that kind of scenario, we have 2 parts. Part 1 is theory, basically orientation kind of format, and that is basically the same every week. So if we come next week, early part of it, you'll probably hear the same thing, maybe different group, maybe same group, okay? So because of new people coming in at different times, we allowed for that by offering a orientation, of course. We don't want to extend it too long. Typically it takes about 30 to 45 minutes, maybe an hour. Then we go into applications. Basically, we will be working on using this as a template, this sheet of paper, you can pass it on. Sure. Okay. And this will be a model by which we'll teach you how to write a business plan in a format that will be useful for for people to work on. Okay. So we'll take a real world example. We'll be breaking into groups, maybe 2 or 3 people for a project. It can be your own project. It can be somebody else's project. If none of us, we can assign projects, and we'll be working on that. And it will probably take an hour and a half. So we'll break out into individual rooms. We'll talk about it. Can you take that? And at the end of it, we'll come back and we will discuss as a total team what's happening. So it's to us to give that experience. So I am Mohan Venkataramana. I have 30 years of experience being an entrepreneur. I build products in all verticals, healthcare included, healthcare, energy, retail, real estate, financial services, transportation, etc., etc. And we do like a lot of software, hardware development, design. We have IoT applications, stuff like that. Kalyan Kalwa is the founder of Health Innovators. He can talk a few things about Health Innovators in a minute. And Pavel Hardeke was in the early stages. He was also involved in the design of this program and format, and he's been working on it with us off and on. He's also both Dr. Kalyan and Pavel are physicians. I am a make-believe physician. I have PhD. I don't do any operation stuff. So the idea of this program, the whole idea of the whole entrepreneur, all this series of program is to help teach people the risks, skills and strategies to reduce the commercialization risk. And we want to teach them how to build a business, how to start a startup. Technologies that people's technology, but we discuss around that and have as much of support as we can get so that they can they can start on their journey in the entrepreneurship world. The idea for all this, including evidence-based entrepreneurship, is to understand that there are so many things. You go to a school, you can take MBA program, they teach you entrepreneurship, 3 courses and 5 courses in 2 years, and you come back and confused. What we are doing here is reduce that into a small set of absolute minimum that you have to know, and then build on it. So we talk about customers, we talk about evidence, we talk about products, we talk about your strategy. We do it all the time. So you'll see me say this again and again and again in the overall context of the entrepreneurship. Okay, the customer discovery process is inherent or intrinsic to the whole process of business plan here. You don't write a business plan in vacuum. You write it with a focus on what you're trying to do, shortest possible path. It's not about learning theoretical aspects of entrepreneurship. It's about the practical aspects. How do you get it done? How do you get your business off the ground in the shortest period of time? It is about experiential learning based on our experiences, and we also hope that other people who come in here have their own experiences to share, and it's collaborative. That's what we're trying to do. Health Innovators is a non-profit company, and it was set up about 5 years ago in Boston area. Our goal was to be a premier networking organization, and initially we had a lot of challenges, but at the end of it, I can confidently say that we have one of the great networking organizations in healthcare in Boston area. We have been consistently having monthly meetings. So far we have about 15,000 to 18,000 people in our network, and all representing all aspects of healthcare. We have doctors, we have administrators, we have nurses, we have students, we have researchers, we have C-level executives, we have people interested in whatever. And we have.
I'll be right there.
Hi, we're at the elevator finally.
I'll be right there.
Thank you.
So we have a broad spectrum of people that we are trying to leverage the contacts with the entrepreneur. So if an entrepreneur, say, wants to build a product and want to test it out with MGH or with Brigham and Women or whatever, we have people that we can call upon and connect so that they can quickly test it out. They can get the feedback, right or wrong, and all stuff. So they don't have to waste their time or struggle hard. And we provide all the intangible resources associated with that and many other things. We have space, we have help them hire people, get interns, and so on and so forth to help people. It's a nonprofit. As I said, mentioned that. We have monthly meetings. Monthly meetings are with panel discussions and question and answer, the standard fare about it. We charge the money around $35, $25 to $35, and we get about 100 to 120 people every month. So that's very well received in the community because there is added value to that. So after seeing the success of that and after having had success for about 5 years, this year we started this program about entrepreneurship and the sequence associated with this because we want to use the synergy between the network that we have created or developed so far to make use of it in entrepreneurial endeavor. The various events I mentioned to you, including that, we have equity crowdfunding platform, which is what we are planning to do, and we are trying to create financial resources for our entrepreneurs so that they can build the rest of the things. So the overall purpose of the academy is to conduct classes and seminars of contemporary topics of specific interest to the healthcare and startup communities. So given all this, let's talk about evidence-based entrepreneurship, what this course is all about. We'll talk about entrepreneurship. We'll talk about understanding the relationship between entrepreneurship and healthcare and what the pros and cons of that, what the synergies, what the differences, etc. We'll talk about evidence. We also talk about why this evidence-based entrepreneurship is even important. You will see that in healthcare, evidence-based healthcare is very common. In healthcare, it's all about evidence, outcome-based. Entrepreneurship is not really evidence-based, it's a trial and error. Basically, we keep trying it, what works, etc. And we'll see that why this is important is in the context of product development paradigm. World is moving faster and faster, and how do we do this? And we'll talk about that in a minute. And after that, we'll talk about evidence-based entrepreneurship itself. What do we do? And we'll briefly introduce the value proposition worksheet that we have, and we'll discuss what needs to be done, and then we'll dive into the solution, actual application of that. Okay, so far. So, what is entrepreneurship? If you look at entrepreneurship, people have different opinions of entrepreneurship. Basically, people know what
there's one there, there's another one there.
People know what entrepreneurship is when you see that happen. Everybody has their own intrinsic understanding of entrepreneurship. So if you look at any characteristic definition of entrepreneurship, you'll always find that no matter how you define it, there are exceptions to the rule. There are some activities which will fit your definition but may not be considered entrepreneurial. And there may be some which will be, traditionally speaking. So if we try to find a true definition of entrepreneurship, it's a waste of time, basically, even though we know what it is, right? So I'm going to pick only selected aspects of entrepreneurship in the interest of time, without going through brainstorming, and try to show you where the differences are, where the significant portion of entrepreneurship plays into our game here. So if you look at entrepreneurship, risk profile, entrepreneurship is by definition a risky endeavor. You take risk. If you don't take risk, you're not really being an entrepreneur. First risk you take is with yourself. You get out of your job. You start getting your salary, correct? You no longer get your salary and you worry about how are you going to pay your bills. Right there, first level of risk. And then the people around you are start taking risk, assuming a risk, your family, everybody else along the way. So entrepreneurship is inherently a risky behavior. You want to try it out. You want to, okay, let me try. What happens? I'm going to jump off the cliff, and when I'm falling down, I'll see what I'm supposed to do when I'm hitting the ground. On the other hand,
You can sit there.
healthcare is not at all risk-taking. It's risk-averse. You want it to be that way. You don't want the doctor, when you're on the operating table, trying to be entrepreneurial and see what happens if I cut your heart this way or that way. You don't want that. You want the doctor to know exactly what will happen and do the right thing. So healthcare is completely risk-averse. Entrepreneurship is exactly the opposite of that. So now you got a problem of being an entrepreneur, going into a non-risky environment like healthcare and trying to build products. So you're going to tell, and I see this often, people go there and say, I am so-and-so, we got this great mobile app or whatever it is, doctor, use it. And the doctor is going crazy. How do I know if this works? Has it gone through the cycle of everything else? So doctor is very reluctant about using it. And entrepreneurs think, I'm giving you a great idea, why aren't you using it? You see, it's an attitudinal difference between the two players havoc in the entrepreneurial world. Now, it does not mean that healthcare is not creative or innovative. It is creative. We do drug discovery all the time. We discover, we put billions of dollars, discover new medicines for all kinds of diseases and treatments and stuff like that. But the way healthcare deals with risk is repeated testing. It takes 5-10 years to bring a drug to market. We want to test every piece of it 100 times over to be absolutely sure nothing fails. And then we bring that idea to the market. So there is innovation in the healthcare, but the healthcare discovery is predicated upon the slowness of it. So now the other dimension of this is the speed with which discovery is being made. Okay, so if you look at healthcare, they want to be very slow precisely because they are discoverers, and their way to end up or accepting risk is by being slow to make sure none of the mistakes repeat. On the other hand, entrepreneurship is very fast. We are in an environment where people come in on Friday, total strangers, don't know anybody else, become a farmer team, work on 48 hours, and at the end of it, they have built a product and they're ready to go to market. That's all it is, basically. This is the environment we live in. So we have a very short lead time. And if you're not fast, the competitor is going to be faster than move forward to the market. If you want to capture the market, you have to be good fast. Okay, that is entrepreneurship. So as you see, there is totally two different worlds out there. One is very risk ready and want to do things fast. On the other side, healthcare is very risk averse and want to do things slow. They want to do only what they're sure about. So now you've got a situation, you're trying to be creating a creative and entrepreneurial in a setting where the environment is not ready for it. So how do you do this? How do you still be an entrepreneur, creating, innovating, bringing new ideas, innovation, everything else? How are you going to do it in a healthcare setting? Is the challenge that we are addressing. Make sense so far? This is a statement of the problem. This is the problem we are addressing. And how we are going to do that is by reducing the kind of fluff and try to do the focus on the issues, focus on the problem and address that. Now, 10 years ago, 15 years ago, all schools, even today, many of them, they teach how to write business plan. So in fact, that's one of the prerequisites for getting an MBA. You go there, they will teach you, you sit down, they'll form teams, 5 or 6 people, you guys go hit the library, research, and come back. And after 6 months, you write your 100-page business plan and maybe make a presentation or two. And you know that, and the professor knows that, and the people who are going to hear know that. The business plan is obsolete the day you finish the business plan. Everything you wrote is 2 years prior history. All the research that you have done, databases you picked are all old data. New data is not available. You're making a decision and your business plan based on past history. So it is really irrelevant, and the day you finish the document is irrelevant. You go to the VC, and VCs initially took it, and then they realized that this is meaningless. You wasted 6 months of time learning the history, which I don't care. I want to go forward. I want to invest money. I want to know what to do forward. I don't want to know 6 years ago or the last 2 years ago what happened. So they said, the VCs started coming up and saying that don't give me that 100-page stuff nobody's going to read, and don't give me a financial plan which you yourself don't understand. Besides, if you're coming to me with a product, I know the market well because I live and I invest money in that. So I don't really need the numbers because I won't believe it is a figment of your imagination. And besides, any financial plan can be made up. I can make a financial plan for $20 billion, $30 billion for nothing. It doesn't make any sense. I can just put numbers. So they want to know, give me an executive summary, 3 or 4 pages. Don't give me more than that. Summarize what you know and tell me so that I can read in a maybe a day or so, understand. More importantly, I don't want to know the financials from you. I already know that, but I want to know if you understood the financials. Give me the assumptions. Give me what went behind. What are assumptions you made behind that scenarios? Explain to me that. So that was 3 years ago or 2 years ago. So business plan, competitions aside, all passive, basically. So they wanted executive summary. So people started writing executive summary, and sure, world moves faster and faster. And nowadays, they don't even want you to write 4 pages of executive summary. It's a waste of time. Even that is too slow for them. Instead, just give me one sheet of paper. In one sheet, you tell me all the things. Government was actually moving forward in that. If anybody have filed or done any contracts for the government, they would ask for quad chart. Just 4 lines, 2 lines in a page, 4 sections, and there are 4 things. You have to fill up those 4. So your entire technology, all the things you spend beautifully wondering, writing, coding, everything else, should fit in a quarter of a page maximum. That's all you can do. That's all the space they give you. And so everybody in the defense and everywhere else, they want a quad chart. The commercial world is a little more lenient. They give you a little more space, basically. Okay, but nevertheless, it is still the same. So they want you to write 1 page of relevant information. But just because you write 1 page doesn't mean it's easy to write. You still have to do all sorts of work to get that. But you have to distill it to such a level that you only have to give the pointers to what you can. And you should be able to defend it. You should be able, when you write something there and somebody asks, prove to me, you should be able to prove that. Just precisely because it is shorter, it makes it harder. So that is our model. Okay, so we will be talking about the business plan canvas. We'll talk about how it's going to be done and what we are going to do with that. Yeah.
At this point, do you need the POC? Do you need the POC at this point? Because you just mentioned that some people may need to see how it works. Do you need the proof of concept at the point when you're looking for
I do not think at the initial stages. When you go to the VCs or customers, they first want to understand if you understood it. Then they will ask for proof of concept, prototype, and everything else. But they won't ask you, do you understand? There are basically 2 questions. What product you are going to be? What market you're going? What product you're building? Is there a customers for it? And have you talked to the customers? First and foremost. If you talk to the customers and you can show that the customers really need it and you have proven it correctly, you've gotten the right evidence, then I want to talk to you further. If you haven't done that, I don't want to talk with you. Go do that first. I don't want your imagination. I don't want to say, I know this, I've written a PhD and I know. No, I don't want it. I want to know who's paying and talk to the guy and does he or she want to pay. Then I will talk. Then I will ask all sorts of questions I'll ask. But that is the first question you have to do. Traditionally, people haven't done that. People traditionally after writing a business plan, they go and hit and start writing code or developing the prototype, and they've spent 1 year. In fact, I was guilty of it. First time I wrote 1 year, and then I said, "How am I going to sell this?" And that's where the reality strikes. No, it doesn't make any sense. Okay, so we talked about this: the speed of the business, the speed of technology evolution, and speed of market evolution are critical in your design. What you are doing should match with that. If the market is very fast, you do not want to go with a slow-moving process in you, because by the time you get the answer, the market is somewhere else. So you should align yourself with what's happening in the marketplace. Some of them are slow by nature, and you cannot avoid it. But even there is an element of speed in that, because you are always competing with somebody else trying to do the same thing. So this is a business model canvas. All of you have in front of you a copy of that. And basically, we are talking about 2 pieces of information here that is central to it. One is the value proposition, which is in the middle, right in the middle. And the other one is the customer segments. Customers. So these 2 are primarily what we will be talking about initially. But other things are important as well. So for those of you who are starting out the first time, today, for the rest of the day, you will be working on all of these things. So take an idea and look at it from a bird's eye global picture. Look at it, all aspects of it, just to get a feel of it, okay? So write as much of details as possible in each of these boxes. And then subsequent weeks, as you move forward in that, you will be taking individual pieces and you will be evaluating, scrutinizing every piece of it. We'll be talking about it, we'll be critiquing each other, and we'll come to a finer, fine details of all these things. We'll summarize all of this to more exact specifications. Okay. So first, as you're doing today, take a broad picture, broad approach, and look at the whole thing. That will give you a better understanding of what's going on in the market. So this is the same thing. It's one small change being the competition being added here, which is not in this chart. Basically, this is the order you do. 1, 2, 3, 4, 5, 6, whatever it is. Okay. So this is the way we'll be doing it. Now, so that is the exercise for the rest of the sessions, basically. Today, tomorrow, today, next week, following that, as people proceed. And by the way, some other people have done this, taken their product, taken their idea, and moved forward, and they've done a wonderful job of, getting the validation for it, and they're making it, progress is very fast, as we can see. So, before we continue doing that and dive into all these things, there are a few things I would like to talk to you. Basically, these are some of the ideas that I think are relevant in the overall scheme of things for an entrepreneur. Some people know this very well, particularly if you are into statistics, if you have good understanding of statistics, or if you are into biology. You'll probably relate to some of them, some of the concepts I'm talking about. But if you're neither, if you're a computer programmer or somebody else, you probably are not familiar with this. So instead of going into the deep detail, by the way, no math involved at this point, even though there's a lot of math underpinnings here, we'll just touch upon a few things that might be worthwhile to keep in mind as you start working on this entire thing. Okay. The first one is hypothesis testing, and this is a course that provides central to this is evidence. So we are talking about evidence-based activities that are relevant in an entrepreneurship effort. So evidence and what you make of the evidence is intricately tied with hypothesis testing. So you make a hypothesis, you make some observations, you observe something. The classic example is that you are walking in a park and there is a guy selling ice cream and there are 100 people standing in line to buy that ice cream or get that ice cream better. Now you observe that, and being an entrepreneur you want to find a problem which you can solve. You got a hammer, your solution framework, you want to solve one. So everything that you see is a problem that requires solution. So you say, okay, well, there is a big market in this area for ice cream. 100 people standing in line to get ice cream. Therefore, there's a need. Now, you don't know if it is true or not. You had an observation, you saw something, you observed something, you jumped to a conclusion. It could be right, wrong, we don't know. How do you know that? How do you know what you're saying is true before you start going and opening up a ice cream shop in that place? Maybe that's just they had a party and they were all going to pick up their ice cream because the party guy gave that. We don't know, basically. So the idea is you make a hypothesis and then you want to test that hypothesis. Between hypothesis and testing that, you have to design what experiments you want to do that will give you the information you need to validate that hypothesis. So you have to define, okay, this is what I'm going to do. I'm going to go talk to 10 people in the line and see what they're doing. Why are they standing in line? What is it that they want? What are their expectations? Maybe that will give you some more insight about what's going on. Now, when you do design of experiments, it's again, for those of you who have been in science, biology particularly, design of experiment is a big topic unto itself, and you probably know that. But for those of you who aren't, when you design, you have to design and figure out what questions would you ask, what kind of questions you're going to ask, write the scripts word for word on a piece of paper, and you also have to decide what you're going to do with the results before you start asking questions. Don't collect the data and then say, I'm going to figure what the result is. By then, your mind is already made up. Or you may have taken not sufficient data. Or maybe you asked the wrong question, phrasing words differently, the outcome would have been different. So you have to make sure that you analyze all these things and make a set of experiments that gives the results that you are looking for, that either proves or disproves your hypothesis. And once you have that, once you have the data, when you do the experiments and you collect the data and you analyze based on the premise that you initially selected, then you will get some insight. And that insight may prove or disprove your hypothesis, in which case you change the, if it disproves, change the hypothesis, move around and go one more cycle till you come to a valid conclusion that you can objectively say is what's happening. Make sense so far? Now, some of the pitfalls here is when somebody does the design experiments, how many people should you ask? Suppose there are 100 people standing in the line and you go and ask one person and you got the answer. Can you come back and run? Say, I got the answer.
Now we gotta do more.
2, 3, 5, 10, 20, 30, 40. How much is good enough?
As many as you feel comfortable.
Statistics says that you should have at least 20 data points from a sample for you to be confident that the data you're deriving is statistically meaningful. That's because if you look over the normal distribution and then try to see at what point your sample mean varies from this population mean. Sample mean, you ask n number of people, you find some answer. You ask everybody, you get some answer, how close they are. And you have to differentiate between them. With those two in place, then you can understand how many people you're going to ask. This is one of the reasons why somebody can, in the political field, they can ask 1,000 people and come up with a solution of who is going to be elected in the press or what's going to be the outcome of the election of 1 million people voting. You don't need to know the whole thing, but more you have, your confidence level increases, but it doesn't have to be infinite. It very quickly approaches an asymptote, basically. So understanding a little bit of statistics helps. I'm not saying you have to be a master in statistics, but helping some of it would help you make meaningful conclusions out of the limited data that you collect. So we talked about observation and the difference between observation and evidence. Observations have to be quantifiable. If you just have a gut feeling, it is not really an observation. It has to be somewhere quantifiable, somewhere countable. And it should follow a specific pattern that it relates to. And most importantly, you should be able to define input-output conditions. That means I'm saying you should be able to define the environment in which you're taking the observation. You don't know anything about the process, but you know the environment. In the case of ice cream, people standing, what time of day, what day of year. Some of the things you should have so that you can make some level of repetition of that, or some level of good understanding or estimate of that environment. So it should be quantifiable. You should have a correlation. But evidence has a much stronger requirement. Evidence requires that it should be based on a hypothesis. You're going to collect evidence because you're going to prove or disprove a hypothesis. Observation can be anything. Evidence is connected to a hypothesis that you're saying, I'm going to prove it. The conditions, both external and internal to the process, have to be very well defined for you to have confidence in the evidence that you're collecting. Again, you have to know how many people, what's happening in the case of biology, what's happening within the system, scientific principles. All these are necessary for you to have good evidence to prove what you want to do. Final one is null hypothesis. Is very important for those of you who are not statistically oriented. The basic idea is that in life, you can never prove anything. That's the basic axiom of life. In order to prove something, you have to show that every time you do something happens, whatever you say happens. And that is a large set. You can do that. But you can disprove that easily. You can disprove something very easily by all you have to do is show one evidence that it is failing. Show one failure point, you have proven that it doesn't work. But if you want to show something works, you have to show it 100,000 times. So the idea in statistics or the proof of hypothesis is to have a null hypothesis, which is opposite of what you're saying. So it's a whiteboard. No, it is not white. People will buy blue pencil. There are two hypotheses. People will not buy pencil.
Yes. Hello. Okay.
People either will not buy pencil or people will not buy blue pencil. Depending on which you are doing, the null hypothesis will focus on what you are trying to say. Once you have that, go through the cycle of hypothesis testing and disprove it, not prove it, but disprove your null hypothesis, thereby proving your hypothesis. So this is one other thing that we do, and some other things we'll probably close very quickly. Testing in the case of entrepreneur activity that we are talking about, even though testing is again a broad topic, we are testing our relevance of our product or idea to the marketplace. We are talking about, is there a customer interest, basically. Or we are testing, is a customer is willing to pay and is a customer able to pay. We are trying to test only those things. We're not testing the whole world at this point. We're testing preferences and the priorities of the customer. What do they want to do? We also have to care about data collection issues and hypothesis, null hypothesis we talked about. We have to identify cause effect, which is a cause, which is the effect is very important. So as not to confuse the two. I've seen this happen so often that people are confusing cause effect and building a whole premise based on that. Statistical versus empirical. Statistical gives you the data-based approach. Everything is about data, and data is important in nowadays. But don't forget the fact that there is some intuition. You are an entrepreneur. You are going into the business because you think there is a market. You don't have a proof, but you think that somebody is going to buy. So the intuition is what started your entrepreneurial activity, and don't lose that along the way. Even though you're going to collect data, everything is nice, but there is lots of gems around somewhere lying around there, which you can obtain from intuition, from your guess and gut feeling, rather than data. Data should support it, but not the only thing in your entrepreneurial effort. And there is also important to understand natural versus artificial variation. Some things are random. Things happen in random. Things happen in some sort of a distribution. And you have to understand what is naturally happening, why people buy, who is the early adopter in the market. If you throw a product at 1,000 people, 10 people may buy it. But is that 10 people significant? Is it natural, or is something that you artificially can manipulate and market it or do something to add to that that early adopter mix? So these are some of the things that you would probably be paying attention to, probably a few more there. What I would do is I would stop here instead of going further. We can talk about the rest of it as we move forward. We're coming around 6:50 around this. So this idea is to give you the orientation about what it is. The real fun is to fill that paper, to take an idea and work together with a couple other people, brainstorm on it, and come up with a model of how you did this. Is right now, unless this product that you're building is your own product that you're trying to come to the market, if it is, wonderful. If not, any other product, see the behavior, how it is being done. One of the things that you want to do in this is when you write a value proposition, you're going to go there, you're going to discuss. I have seen many different, I've seen the discussions take many different formats. Some people meticulously try to work on it. Some people just use that network and understand each other person. All that is fine. Everything is fine. There is no, at this point for the first level, there's no issue. But you want to do one thing. What you write and try to focus on the value proposition and customers, particularly value proposition. On the back side of the page, there is a bigger diagram that breaks out this into a little more, few more questions associated with that. Please try to answer it. Use that as a benchmark. Again, this is a tool. Use that with your common sense. But one of the questions I would ask is, when you come to the value proposition, I want your observations first. Okay, what in your relating to the product, you say, this is what my observations are. I think there is a market for this. Then ask the question, what is the evidence? How will you collect the evidence? What evidence do you need? Who is the target market? Who should, if you said something, XYZ, there is a market for blue pencils, I would ask, how is the market sizing? Tell me the market. Who will buy it? Give me a definition of your customer base. And then what kind of questions will you ask? And how many people? 10 people, 40 people, 100 people, whatever it is. And where will you go reach them is another question. But having reached them, what kind of questions will you ask? Write them down. Okay. And I want to see your first step towards taking every sentence that you write, critically examine, and try to see what steps will you take to collect the evidence. Next step is actually doing that. Between now and next week, whenever it is, if you want to take that step, take the idea, take that thing, go find the people that might be relevant, particularly if it is your product. If this is a product you want to bring to market, take that seriously and go talk to the customers for that observations and collect evidence and then come back and present the evidence to other people. I talked to 50 people, 30 people said this, 20 people said this, whatever it is. With open mind, find this. Now, what happens is this. When you started with one idea saying, this is a great product, and you talk to the people, and soon enough, your mind changes saying, this product is not that good, or even not there. But there's something else which you never thought of that is really valuable that you can migrate to. So you can pivot between one product to another idea that will allow you to get to the right profitable product in the market segment that you want. That's the value of customers. It will either prove that you're right, in case wonderful, go forward, or it will prove you're wrong, find a pivot point, move forward with that. So that is what you should be doing. Even as you're writing it, look for what evidence. So when you come back after an hour or so, when we discuss this, I'd like to see, for those of you who are doing, look at the evidence and also give me how you'll collect the evidence, what kind of questions you'll ask. Okay, don't worry too much about the solution at this point. Only the product, the need, how will you determine the need, how will you verify the need. Next step is solution. When you come to solution, you will have to ask to do the same thing. Is the solution what you want? Is the customers want that? Give them an idea and say, ask them, would you buy this? If not, what else would you, why would you not buy it? Why would you buy it? What's the price? All this stuff. Fair enough? So, Kalyan, you want to take over? I mean, like, how do you form the teams?
We'll discuss about ideas quickly.
Okay.
If someone has any ideas, we'll go around the room. Basically, ladies and gentlemen, thank you so much for being here. I'm very excited to see you all. So now the lecture is finished. Now we're going to form teams. So if you have any ideas, this is the opportunity for you to bring it up here so that we can discuss it. We'll form teams. We'll go to different conference rooms. We'll brainstorm for an hour and a half and come back here at 8:30 and present in front of everybody. So that is the agenda. So
we can go around and introduce ourselves if you're there.
Yeah,
People,
so let's quickly go and introduce ourselves and see if we have people with similar ideas and they want to work on. So let's go around the room quickly.
Do you just want like what we do, like what, or just like do you want just to explain a little bit about ourselves?
Sure. What we do, and if you're interested in an idea, then so basically this is a place for you to get clarity on the idea. You discuss with a team of diverse set of people with different backgrounds, and they give you different kinds of insights. That's what you want, and this is where you can do and make sure your idea it stands the test of time. So
introduce yourself, what you do, etc. If you have a specific idea that you want to work on, say that so that we can bring people to that idea, those of you who are interested. If you are already find an idea that you want to work on, say so as well, so your name can be there. So Kalyan will be putting on the whiteboard, forming teams.
So I'll start.
Yeah.
My name is Gabriel. I'm an accounting student at Fitchburg State University. I'm also a firefighter, and I'm really interested in more of like a software, medical software, as an entrepreneur side myself.
do you have any specific opinion in
No, not yet. Not yet.
That's a good area to be in.
Yeah.
Absolutely.
I find it very interesting with software and its ability to do, especially because I work on an ambulance too. Yeah,
You work on
EMT.
ambulance?
Yeah, so firefighters, you have to be an EMT as well.
Oh,
So I work in ambulance, and there's a lot of stuff I feel like that can put technology into it.
absolutely. All we need is the problem statements here. Okay.
Yeah.
Think about it.
My name is Innocent. I just graduated college. I'm going to medical school, and I also work for a biotech company.
You said your position?
No, I am going to medical school.
Okay. You will be.
I'm really interested in technology and healthcare and incorporating the two, especially when it comes to the human body itself. I see a lot of things, in the world that could be improved with technology. That's pretty much it.
Do you have any specific problem you've been thinking about?
Yeah, well, not really, but a lot of things come to mind, like tracking.
Yeah. So, don't be shy about telling your ideas. In the beginning, it sounds dumb, but it gets better and better. Okay. So don't think that people laugh at you or anything like that. Whatever it is, just tell it. And the more people you talk to, you keep on refining your idea. That's what happens.
Jim G. Candelaria, and I'm an MBA and a project manager. I have worked in the health insurance industry for 12 years and have done some healthcare consulting, and am looking to do different things. And that's one of the reasons I joined and am a volunteer with Health Innovators. So I'm exploring joining a team, but I'm also exploring ideas of my own. I'm really interested in one of those tedious places, and they're called waiting rooms in doctors' offices.
Sure.
So how can you utilize the waiting room better, or the eventual goal would be to get rid of the waiting room? So I'm thinking about ideas around that and about putting technology to use there. So, for example, you go in and you register at the front desk. That person who's taking your name would automatically load your information in the system, and you would be logged in automatically into a system that you can then watch videos, or you could answer survey questions. So this is similar to some of the stuff that you've been working on, but
Yes.
I'm just trying to think through it a little bit.
Absolutely. That's great. I'd love to talk to you further about that. And we have all the technology ready. So we just are releasing our health information exchange, electronic health record system, patient portal, and physician portal. So everything is ready. We just have to get a stacked library of videos, and then we can go to market.
All right. My name is Joel Kumar. I've been in healthcare industry for 18 years. I work for Philips Health Tech up in Andover, and then also on research and development. Unfortunately, I won't be able to stay for the next session or the creative session. But I'm very interested in how we bring more entrepreneurship and entrepreneurship mentalities into bigger companies, and emphasizing the speed of innovation and dealing with the slowness of healthcare, the slowness of VA. But I feel like there's a lot of hunger for faster innovation in the prime market. So there's a duality that is going on right now that is quite intriguing.
Absolutely.
we can
How do I
talk-
say your name again? I know. I would like to hear you more.
Joel, Z as in zebra, S as in soda. OLT.
Oh, LT?
Yes.
Great.
Before you leave, you can talk to me. We can talk. Each other. Okay.
Another idea what we're working on right now is, image recognition using AI. And I know you guys are working on the B2B market. We want to take it to the B2C market. We want people to upload their images, and we will do AI and tell if it's suspicious. Yeah, we'd love to talk to you further about that. Grace?
Grace, business consultancy, PR, image branding, artist rep, business rep. I'm just interested in technology, the mind and the soul, and specifically healing alternatives.
Sounds good. Sounds good. Thank you, Grace. Do you have any idea you're working on?
I have written down previously that
Okay, sounds good. All right. Brilliant.
Now, I'm a physician. I did my internal medicine. Now I'm doing MBA, and I'm very much interested to get a new exposure in healthcare industry. We're entering at.
Do you have any idea you want to know?
Okay, then I'm just looking at you.
Sounds good. MD. MBA. Okay.
I'm actually,
Kina?
I'm moving to a profession and the instructor.
Wow.
In similar to a lot of people, to develop potentially increase waiting time, increase physician regarding burnout, and improve therapy sessions for female care specifically. And hopefully increase some kind of holistic alternative format and moving to medicine model. So we could raise the only time that physicians spend per patient, but overall improve some patients.
So you said prenatal what?
Yoga.
Prenatal yoga? So you said you want to work, you're interested in decreasing the physician burnout, prenatal yoga, and then using mind and body and spirit, so holistic health.
Yeah, for
Okay. What else did I miss? You didn't miss anything? Yeah, come on. Did I miss anything? Okay, great. Thank you, sir.
Hi, I'm Sunny. I'm a cardiology fellow.
You got a lot of doctors here.
Awesome. I'm interested in healthcare and technology.
Do you have a specific problem, sir?
No.
Because people have been using the, rain scales for, heart failure. Yeah. So people are already doing that. So we can explore more about other things. Great.
I'm new. I'm also a cardiology fellow. I was on my MBA. Just eventually go on custom tailored scripts because I believe there's a market out there for certain individuals to get more comfortable in their coding in the setting where
Great. Thank you. Sunny, I just want to get back to you. Because today we were thinking of how to use Alexa, because doctors hate entering into the medical record, electronic health record. They hate that. That's what this is all about. And we wanted to use voice assisted Alexa technology, but we wanted to make it so small that you can fit it in your stethoscope, clip to your stethoscope, and you can just speak it, and it'll give you stats, whatever stats you want on the patient and things like that. That's something I want to look at.
Hi everyone, I'm Avi. I came here essentially to learn more about the value proposition canvas. It was very interesting. I work full time with Dell EMC in the strategy and planning team. So one of the things that we do is we take a 5-year view and 10-year view of the market, and we see like how things will evolve. So yeah, anytime if you're looking to work on the genomics data side or something like that, I'd be more than happy to talk to you about the IP underlying it. Yeah, I'm available after 5-10 minutes after that.
What's your name?
Yeah.
What's your name?
Avi.
Yeah. So Avi, we're interested in, we have our electronic health record system, and we want to integrate genetic data and patient-oriented data, including IoT, right? Everything like that. And I want to talk to you about that.
Yeah, sure.
I'm Desna,
How do I spell that?
DESNOR. So I'm interested in drug delivery, but a separate idea for the sake of ideas was sort of having a platform that's almost open access or more accessible for journal articles. So you know how there's Netflix, there's Spotify, but what if we had one of those platforms but for journal articles so that you don't necessarily have to have a big affiliation to have access to that kind of information, and not just like in healthcare, but in general. But you can start with medicine, but that's especially important for people who don't have that much financial backing for access to those like research. And also in countries, sometimes they don't get access to American journals because of sanctions or just because they don't have enough money. And also for that platform for other people who don't have like ACS backing to actually get to publish their own articles about the research that they're doing in the community.
So is this for healthcare professionals or patients?
This is mostly for students and healthcare professionals. Like if you're a doctor in a small town and your hospital doesn't have access, or you're just an entrepreneur and you don't have that kind of academic backing to get access to journal articles. I read that there's a bunch of African doctors who changed their approach to prenatal HIV care based on abstracts. But as they read the papers, they could have found out that the abstract didn't have all the information. So after they had adjusted the way they treated patients, their success rate actually dropped. But had they had access to those papers, they could have just seen that the way that they were treating beforehand was more effective than what had been published. But after I graduated college and I didn't have access to a lot of journal papers unless I pirated or contacted a friend, I just thought it was more important for us to have a platform where you can pay $5-10 a month, which you can have a whole catalog of different journal articles to access.
That's like demand.
Yeah.
I just don't know how to compete with the Elsevier's and the.
You can take over. You can do
Take
it.
them out of business.
But yeah.
You know, we can compete with them by providing physicians an outlet to publish health literacy content.
Because also reviewers don't get paid, so I don't understand where the actual big cost of me paying $20 or $50 for an article is. They're not printing the page. No one needs physical journals sent to their offices. So if you're using an application, you're just literally paying for the software, but you're not actually paying, like all those administrative costs do not make sense because people are paying for the articles, reviewers aren't getting paid. You just need a bunch of people who are qualified in their field to do the review of the research, and the public can have it.
Absolutely, it's a great idea. And I'll connect you to another lady. She's a physician from Turkey. She's also working on an online learning platform for Syrian doctors who have been displaced. And she's going around asking professors so that she can live record the lectures and make it available to everyone. That is one idea. And also we should give physicians an opportunity to publish whatever they want to publish. And we need to allow other physicians to rate that article so that they go up, just like Reddit, and then the top articles we can share with patients.
What you do is go to the people who publish the articles, the authors, ask them if they can give a simplified version of that people can understand, because they know the subject matter. They can quickly put together something that's more readable.
But I mean, like even in general, all the people interested in an academic article, they're just you don't even know if it's relevant to you, but you're not going to pay $30 just to check out. Does it matter? So just a platform where you can have access to a bunch of different ones, just like you can stream music, stream shows these days.
Great.
Wonderful. Great idea.
Mohan, can you please bring up our website in the meantime?
Sure.
Hi, my name is Sarah Ting, and I head up a nonprofit. So this is my first time here, so I came kind of to listen and to learn, but I wanted to bring something to the attention to the healthcare community, and I'm going to lead off with a quote by Mother Teresa. She said,
1 second. Yes, I'll be right there.
It's an important quote, so we
this is an important quote for you to hear. You're going to miss it. This is a quote that I can almost guarantee you most people in the healthcare profession have never heard of it. And it's a profound quote. She said, I've come to realize over the years that being unwanted is the worst disease that any human being can experience. That is not listed on the disease list, let alone at the top of the list. So I come here to share that with healthcare providers here. I come here to also ask if there is a way that we can solve this problem called being unwanted. Does it need to be turned into a business model? Because I kind of like was listening to what Grace said. Healing the soul and the mind. Because there's a great quote by D.H. Lawrence who said, the soul needs beauty more than bread. So food feeds our body. What is feeding the soul? And so I believe that the arts can play a powerful role to heal all those who are feeling unwanted and all those who are homeless and are already unwanted. And if we, not just in America, but we in the globe, don't learn how to value all people, we will continue to be more and more divided. So I come here to share that quote with all of you. I come here to listen and learn. I don't know if I can stay for the whole time, but I wanted to bring this to your attention, what Mother Teresa said, not me. You don't agree with her, go argue with her at her grave. Being unwanted, the worst disease. And then the other quote I want to share with you that I think is very appropriate for any entrepreneur. If you want to solve a problem, he said, solve a problem? Einstein said this, you cannot solve a problem with the same consciousness that created it.
Oh, wow.
You must stand on a high ground. And one last comment I will share with you that was made by the New York City Commissioner for Public Health. New York City. She stated at a meeting, it is time for healthcare providers to stop being afraid to talk about racism. Stop being afraid to talk about this issue. It affects all of us, whether we want to acknowledge it or not.
Give her a big round of applause. Good work. Good work, Sarah. Thank you so much.
Me. You passing those papers? Oh, sorry. Okay.
Martin, go ahead.
Couple.
Your name, what you're into, an idea.
Oh, my name is Martin. Martin Secho. I come from Uganda. I go to Cambridge College. I'm doing research on relapse prevention at workplace, and I work with the New England Center for Veterans as a case manager. Thank you. Sorry for being late. I was just traveling from New York.
Okay. So you're working on relapse prevention of opioid addiction.
Workplace.
At workplace.
Yeah.
Okay, good. Good. Thank you, Martin. Hi.
Hi, hello everyone. My name is Divyanshu. I'm from India. I'm founder of Spara Studios. So we are providing physiotherapy rehabilitation to your doorstep. So it's a platform on which you simply play a game in a physiotherapist. I'm also president of VRARMR, India's first and largest virtual and augmented reality community. So we have 65 plus partners and also 200 plus developers. So I'm here to attend and listen and to discuss how to go ahead.
Yeah, we'd love to work with you. The state of Massachusetts is in cost of spending for rehabilitation. The state of Massachusetts is number one, and people are looking for solutions in the state of Massachusetts because it's crazy the amount of money we're spending on rehab. And I think your solutions can be a great way to keep. So let's talk more.
Sure.
Thank you for attending. And Uber physiotherapist also is a good model too. Go ahead.
Hi everyone, my name is Anand. I'm a recent graduate from Northeastern University. I'm a maker-related engineer, so basically I'm here to collect everyone's experience and enable and help everyone in any way that I can. My skills are in maker-related stuff, so 3D printing, laser cutting, anything that's related to your hardware, I can integrate that with your software and create a good user experience. So that's what I'm.
Awesome. Thank you, Anand. So let me talk to you about some of the. Mohan, can you go to startups? Yeah, treatment bed finder. So for people who are interested in IoT solutions, this is a real solution we're all working on. And just opioid epidemic is a big problem in America, including the Massachusetts. So people can't find beds, addicts cannot find beds, and we're working on this solution. So it's an IoT-enabled solution. You can scroll down a little bit, and scroll down. Quickly show them the next. Go to the next slide. Yeah, those are slides.
Which one you want?
First one, IoT solution.
If you press play.
Press next.
No, top one.
Oh, you mean this one?
No.
Just scroll up. Just scroll. Yeah, exactly. Just scroll up.
Yeah, like
Not
Oh,
the
okay,
first
I
one.
see.
Yeah.
No,
Scroll
above
up.
slide, above slide.
Wants the
Just
first
go
one.
up.
The first one, not the
Scroll
bottom.
up. Scroll up the web page.
You would have to move to the white space, like
Yeah.
your
and
right.
then scroll up.
This is what you wanted, right?
No, there's one above it. The one above
Yeah.
it. That's that one. So if you go to the next slide on this, there you go.
This is the bed finder. Our mission is to connect bed seekers with bed providers in real time. Wait a minute. There's a huge demand for beds, and they're not available for opioid addicts. All they had to do, and Martin can talk about this more in detail because he works in that area. And right now, if addicts want to find a bed, all they had to do is call different treatment centers, and that's a very manual and laborious way. By the time they find the bed, they all already lose the motivation to get treatment. So there's a huge opportunity lost here. Go to the next one, please. This is our solution, what we're trying to do. Next one. So we want to attach these things, the dash buttons for each and every bed. So when people are when the patient leaves and they're changing the bed sheets, all they have to do, the cleaning people, is click a button, but the light will change green. Then in the central database, it'll tell us that the bed is available. And go to the next one. If we don't want to find each and individual bed, then we can have this dash button at the checkout where patients get discharged, and the people who are discharging, they just have to click this button. Yeah. So basically, we'll collect all this information and provide them on a web or mobile app, so that all they had to do is go to that app and see what are the beds available. So this is one solution. The other solution, what we're trying to, this is the easy solution. The other solution, what we're trying to do is connect all the electronic health record systems and then centralize them. But it's very hard. Some of the treatment centers don't have any electronic health record systems, and it will take ages to get permission. So that is one. So we're working on that solution today. Go to the next one. Go to the startups on the menu. And opioid relapse detection. Yeah, scroll. So we're trying to detect opioid relapse in real time. Yeah, that is that. So urine analysis, if the only way to find out if someone is relapsing is take a urine sample, and it'll take 7 to 10 days to get the results, and it's too late. So what we want to do is we want to use technology to capture relapse. One is we can wirelessly monitor the breathing and heart rate. MIT Media Lab has come up with a new technology, and it's just like a router which sits in your house, and it automatically gets your breathing and heart rate. I don't know how they do it, but we're talking to them. The next one is we're using a wearable device. I'll talk to you more about that. So this is a solution which MIT has developed. So this is the wearable device, and I mean this wearable device. It's in this company, in this building, and they are also MIT people. So basically, we're collecting vitals and things like that, and if the breathing, basically, if someone is getting OD'd, the breathing slows down to a point where it stops. So it can take up to 15 minutes for the overdosing to happen. So if the breathing is critical, then our devices will will trigger an alert for immediate response. So these are the two solutions we are working on, apart from this. So now let's form teams and then go to separate rooms and then discuss, brainstorm for an hour and then come back. So for people who are interested in Bed Finder, opioid relapse.
Ask her other people's projects here.
Sure. So, one second, I'm going through that. So, Trina had some ideas. Physician burnout. This is a great subject to talk about. Is anyone interested in physician burnout? Okay. Anyone else? Okay. Prenatal yoga. Is anyone interested in that? Okay. Holistic health. I know Grace is interested in that. Right, Grace? Are you interested in holistic health? Just a little bit. Okay. All right. So you got one person there. That's one. And Sunny is a cardiologist and he's interested in IoT wearable solutions. Is anyone interested in working with Sunny on this one? Okay. Custom tailored scrubs. So this is a tough one. But but anyone interested in custom tailored scrubs?
Kalyan is interested.
Custom tailored scrubs? Martin, we want you for relapse. He works in that area. You can work with him like that. Sorry, but we need you in relapse. So connect with him. So
I'll join the physician burnout.
Physician burnout? Okay, +2. All right, great.
Let's see what's going on there.
Great. Drug delivery.
I'll probably make physicians burn out more, but that's good.
Drug delivery. Is anyone interested in drug delivery? Okay.
Pardon?
How about online learning platform for healthcare professionals?
Is that?
What about that project?
What is my right?
Not that project with the USC.
I don't understand.
Okay.
The project with the USC
Yes.
professor.
Is anyone interested?
Hi, one second.
Is anyone interested in working with
Hello?
physiotherapy?
Yes.
Gentlemen?
What was it?
Who is it?
Physiotherapy.
You reached the right person. Yes.
Oh, okay. I'm at downstairs and I'm coming up. I just needed someone to open the door for me.
Just come to the 11th floor, okay?
Yes.
Okay.
Okay. Thank you.
Is anyone interested in working with the physiotherapy solution? Anyone here? Yeah. He has a augmented virtual reality solution and he has some kind of tech solutions for physiotherapy. That gentleman.
I have a question. Is it only you pick one? How does it work? You pick one and you stick to one, or are you allowed to check out different ones just to get
No,
it?
pick one basic.
Okay, all right.
Okay. So,
But other ones you will
this
hear
team
when we
wants to
come
join
back
you as well.
together, you will hear. There will be opportunity to listen to others.
No, thanks.
All right, ladies and gentlemen, so we have 4 ideas. One is bed finder, the other one is opioid relapse detection, the other one is physician burnout and prenatal yoga, and the last one was, yeah, that's it. We have 3 ideas so far.
Probably need 1 or 2 more because too much otherwise. You want to have about 3 or 4 people in the room, basically. So you might want to have about 4 or 5.
That's
Okay. Before people leave, can you make sure that you sign up for me? Guys, before anybody, if you haven't signed up, please sign up on the sign up sheet. Okay, so we want to know who's coming. Okay, go ahead.
all right. So we have 3 ideas. Bed finder. Anyone interested in bed finder here? Bed finder solution. Okay. Opioid relapse detection. Anybody? Okay.
Each one of you have one at least, so that you can go through.
Yes.
Okay.
So bed finder and opioid relapse detection will be in the room over there to the left, and the rest of the team will be here. We'll come back at 8:30 and present our solutions. So we have 2 things. It depends on the stage of your idea. If you're in the initial idea stage, then you need to work on this. It's called the value proposition design. Hi guys. So if you're in the idea stage, you need to work on the value proposition design because you want to make sure that your idea, that is your solution, is adding value to your customers. Forget about building a business. First, you need to understand that you're adding value to your customers. Once you understand that you have a clear value to your customers, then you can work on building a business. So whatever stage you are in, pick either one and then present it at 8:30. We'll see you then.
Okay, so 23 teams?
Yes.
Okay, there are 2 rooms on either side.
Yes.
Okay, one for which one, you want bed finder on this side, opiate on the other side?
Yes.
And the third team was in this room.
Yes, the bed finder is over there, OPR will access to this side, and the position burnout and prenatal yoga is right here.
Is the room open?
Where's the
Share
Huh?
Where's the
subscription for the same thing.
Right
But you
here.
need to be subscribed to the individual.
This
ones of the individual.
Yes, yes.
In terms of UI, I think Google
All right.
This is what we were doing.
I agree. And he
Yeah.
is that right.
I will talk to you later too.
And the cost right now is
Oh, awesome.
That's what we're supposed to be presenting.
maybe ask the regional.
You can make searchability easy. You can make searchability easy. Instead of looking into, you can just go click, and then something like Google Groups. It could be something like Google Groups. Yeah. Or Audible.
Go for it. What's happening?
This position there, it's a little melange.
It's
Yeah.
bunch of cool.
Okay, Jeff, I need.
All right.
You can figure it out. Where do you work?
Brainwave science.
Well, first of all, we need a central idea.
Technology
Yeah.
company.
What, when you
Creates a
were
product that uses brainwaves to get concealed information.
specific idea in mind around that, and how to combat that.
So
From terrorists.
group sessions. Where are you gonna go from next?
I'm looking at a couple of data schools.
Oh, wait, you're applying this cycle?
I'm applying this.
So you already did your steps?
I'm taking it in September. I'm late. I'm late.
Because
I'm applying.
my friend's just sick. Last month pregnant.
I'm gonna be late. I'm taking it into account. That's okay. I'll pass. I'll still get
Facilitated by.
Lexington. Lexington. Oh, nice. Yeah, you guys have
A couple of years ago.
Wow, okay.
Am I right? That's just doing that.
Yeah. I think almost everybody has a crazy person.
Yeah, it makes you feel like you get every crazy.
Yeah.
Let's see what this guy's up to. Oh,
Wait, what did you do for undergrad?
neuroscience.
I just have.
Nice.
But I liked your idea.
All right.
First trimester, they have to take
And when I was thinking about as an eventual allocation, was to try to reduce the weight, not only the
I think so, yeah.
but the weight.
We want that spread out.
So if I were to design an office space, I would design a larger room for patients to be seen and a smaller or a non-existent waiting room. And like I said, when the person would go to the front desk, they would register, and that would automatically register them, log them in. So when they go into the room, they have a console just for them to answer those types of questions. And all they do is walk in, everything is automatically logged in. They don't have to go through all those steps. And so they can do that in addition to watch a video while they wait for the physicians to come in. So it's kind of like streamlines it and allows those people who don't want to wait or change that concept.
Right.
So the waiting would be actually in a larger, have something to do, have something that's tailored just for you.
Yeah.
Yes.
So it would be like a tablet or something they have?
It depends. Ideally, they would have their own monitor, keyboard, and everything to do themselves. It could be just a tablet, but a more advanced type setting would be the entire setup, so that it's something that, you know, and it would be separate, something that they own. So if there was enough money in the facility to do it, they could have their own section that it would be customized.
I'm curious how it would be like during, let's say, like the season with a lot of like viruses going around. If they had like a tablet, because everyone's fingers would be touching it, and like kids and stuff, you know, the mom has it, and then they touch it, and they put it in their mouth. So like kind of like I feel like infection control would have
good to have on the team. Very practical.
So that's what like came to my head first.
Okay.
Because I work like EMT. It's like anytime I'm thinking anything that has to do with like any medical stuff, I assume wash my hands. And with patients and stuff, they don't really know. Like they'll touch anything in April. They don't know.
So that would.
I mean, it could be
another.
Yeah, it could be like maybe there's a station they turn it into someone that job outlook right there, someone they pay, and they just clean them.
Wait,
Yeah.
so the platform you're talking about is like a tablet where they can fill in the questionnaires and stuff just to pass time in the waiting room. Can they also have an option to fill in the survey at home? On time, like before, whether you're doing it beforehand, so that even by the time you come to the doctor and you're explaining, sometimes you forget your symptom. Like if you had a scheduled appointment, you think something hurts, but then you show up and then it doesn't hurt anymore and you forgot it.
I am starting to think about, I wasn't thinking about that in conjunction with this, but I was thinking about ways that survey type questions could be answered before an appointment versus right there when you, all the questions that they ask you right there, the doctor would have that before you even arrive.
Yeah, so that even like the process of diagnosing you and maybe the tests that you might even have to go through would cut down on that time, where they can still have a conversation with you about what you're feeling or what you're really there for, but at the same time, if they sort of have an idea of what you're going through, it might cut down on the actual time they spend with the patient, so that there's not that lag time in the waiting room either.
Yeah, home, like personal at
No, like even you can do it at home. Like you can have an option to do it at home or on tablets that they have in this section, so that by the time they meet the doctor. Because I've had situations where I've talked to the doctor, then I'm like, oh wait, 2 days ago I swear I had this problem. I totally forgot to bring it up because that didn't hurt anymore and I didn't get a prescription for that separate problem.
So unfortunately I got here late, but the app that I'm working, I'm gonna call on Thursday about it. So maybe next Monday I'll have some more. It's exactly that, trying to create a log of how one is feeling. So then you can, especially dealing with elderly people or people that are, with health fragilized, but not so much that they cannot communicate. So the case study that I wanted to work is people with COPD. So I wanted to map the person's day. And so from my experience, I think, this sort of app, but for many other things, like people with Parkinson's or seizures or something, if there was, perhaps the person cannot do it themselves, but, if there is a caretaker or that do this, this note-taking, right? I think it's important because we forget stuff.
Yeah, no, it's extremely important, and ways to tie that into the electronic medical record is also something that's an issue and something that we need to think about. I think that what we're doing is we're coming up with great ideas, but I'm a project manager, and so I want to say what's out of scope and what's in scope. So the pre-appointment surveys, great idea, out of scope for what we're focusing on, which is reducing waiting time. So I'm saying putting things in scope, out of scope,
pre-appointment out of scope. So
Okay.
for now, I mean, that's a great idea, but not what we're trying to do right here.
Okay.
The log, great idea, also out of scope. So what we want to focus on is reducing the time in the waiting room itself.
Right.
Now, there's two ideas. What? Go ahead.
So first things first,
Yep.
I loved because I was sitting in the emergency room 2 days ago, and I actually just had to walk out because I was waiting for a very long time.
Mm.
But what I'm suggesting, not suggestion, it's a question. Would this program application be able to prioritize patients who are going to see the doctor? For example, many people walk into the emergency room. Someone might walk in with a cat on this finger, and then someone might come in with chest pain. Would this program have some kind of artificial
So
intelligence?
your intake already does that.
Yeah, and that's why I'm trying to hear him out. I can see intake is doing it, that's their responsibility, but why would you think it would be necessary to have this application to do that? Is there a reason beyond, like something intake is missing?
If 6 people come in, they fill their information out, and then the 4th person all of a sudden is feeling some kind of, chest pain where the heart is. At that point, obviously, you need a program or software that is able to move that person top of the list, even above the people who have been waiting for about 30 minutes.
But why doesn't intake do that? So you're just saying in the middle of their being there, they start feeling pain, would they go up to the front desk and let them know? Or?
I'm missing something here. Is this program going, because I was thinking that it was going to do some kind of work that the intake was actually doing. In other words, like what's your name, what are your symptoms? Is this, are we on the same page?
No. The initial contact would be, you have to have your intake. The intake is part of the flow.
All right, then.
I wouldn't eliminate that as part of the flow.
Okay.
I would just say that, you've got people, once the intake has been completed, that automatically registers them in the system and gives them access to these additional tools to help with the waiting room issue.
I thought it was replacing the intake.
No,
it would have been
wouldn't.
cool if it replaces the intake.
It's hard to replace the intake, I think, just because.
Who's going to do that?
I'm going to put this down as a thought, but I think I haven't considered what the implications of replacing intake would be. I think that there might be quite a bit of regulatory issues with that. But also, I just think you need some human interaction. I mean, if you're physically there,
But couldn't the intake be done
Oh,
better?
yeah, because
Intake could be done better.
No,
intake could be improved.
The intake could be trained to help people use this software.
Oh.
So like you sit in the room and then the intake is like, do you have any questions? The intake actually could sit maybe in every room. There is an
It could
intake
minimize
right
the
there.
amount of time. It could minimize the amount of time with the intake. Correct.
Yeah.
But the
so
whole
like-
purpose would be, like you said, to reduce the waiting
To reduce
time.
And
So this would be like
this
a-
is
It would
this would be
reduce
like
the
a-
waiting time. It would reduce the waiting time in terms of the staff as well. So
Yeah.
Also, like, you know how when you go to the airport and you can do a self check-in, but
Like
then there's
that.
also people who don't aren't able to use automated machine. So that's basically your
Yes.
model, right?
That's
All right,
even,
yeah. I would
So-
like to sorry, but
So,
go ahead, please
sorry,
continue.
I just meant like, so there's people for, if you're a first timer or you genuinely want some interaction with someone else so that you feel comfortable in the space. But then for those people who probably regular patients, this is just
Another day.
check out,
Yeah.
so they know already where to go.
Right.
But then the intake again has been trained, but not necessarily like you have to wait in line until they stop talking to that person.
one of the things about healthcare is that the workflows are important. The workflows are different from different locations. And you just brought I wasn't thinking about the emergency room. Emergency room is a whole nother story. Intake is a lot more complicated than if you're going to a physician's office, which is what I was thinking. So I appreciate that perspective. That's excellent. All right, so the solution is still the same, but it has greater benefits to an emergency room than it would to a standard physician's office. So I like that. Okay, good. Thank you for bringing it up and pushing me there.
I've done the apps for emergency room for Children's Hospital, which see 55,000 patients a year, right? So the intake, it's dramatically impacted by the workflow that is implemented
Oh, yes.
in the hospital.
Mhm.
Okay, so I think even more important than intake is triage. What does triage? How does triage works? Okay, so that will set the tone, right? Because in some hospitals, the triage, the only thing they do is you sit with someone, you give your name and whether or not you're a smoker, have you been here before? I mean,
Yeah.
it's banal stuff.
A list of stuff they ask.
Okay.
Yeah, like
Whatever it
allergies.
is,
Yeah.
it's banal,
Mhm.
right? And then they ship you to the emergency, and then it restarts the process,
Yeah.
right? Which is
Redundant.
between triage and intake. Okay, so it is you could say it is a modified intake.
Okay.
Right. Now, some other hospitals, and that was I don't know, this could have changed. We're like 11, 12, so it's like 5 years. When you go to triage, when you do a triage, you already have a nurse that is going to stay with that patient. Okay, so that nurse that is hearing the parent explaining the child has this, has this, has this, has that, and the triage nurse is sending to a particular place, there is someone already with a pad, or at the point it was just it was not an iPad, but I think
It was
now
the
it's
same
an iPad.
concept I was going to add
Yeah.
from the EMT side, paramedic side. When you
Yes.
come with the patient, like we do everything, and on scene on the ambulance, we have a piece of paper, and we treat when we bring it in. The nurse, we talk to the nurse, we give the report, and then they triage it, and just like you said.
So, but they are already online.
Yeah.
So they are already. So this nurse that is hearing the triage being done, right? She's going to stay with that patient. Okay, it becomes one of the the team that is working with that child. So by the time they get a bed, because getting a bed is a very important thing. Sometimes you don't get a bed.
In the hallway, they put you.
You put in a
On the
hallway.
waiting room,
I mean, there's lots of things, right? But by the time you get a bed, right? The consultants, the principals, the people that are that are going to take care of that patient have an enormous wealth of information. Okay, sometimes even have orders being put because it's the child in a bed and you already have someone taking blood, taking this, taking that. So. I think this part, like hospital admissions, I think it's hard to intervene unless it's a much bigger project, right?
Right, and that's.
I mean, management of the OR, okay, that is a great stuff. If you can really time all the flows and understand the flows and work with the back end, orders in, orders out, beds in, beds out, all the consultants in and all that sort of stuff. But I think where I see a lot of space with improvement is what you're talking, which is on the appointments part, right? Like, I had one doctor that at MGH, right? It's a very busy office. It was my surgery in my hand. He has a huge team. It doesn't matter because there are so many people that wanted to be seen by that doctor, right? And that thing is going on and on and on and on and on, and you come in the intake I don't know, secretaries or AAs, that they come in first. They already had this list, right? Go straight there and get an X-ray of this, an X-ray of that, and do this, do that. So they prop you, and you have all this stuff and you are ready to roll, but you're going to stay for 20 minutes at least because there's so many people to see that person.
Yeah.
So it's this 20 minutes that I think,
That's
what can you do? I mean, I would love to find you.
Well, what's great that you brought up is like, I was hoping to get very specific, which we have, but you also sort of maybe have this higher level view
and sort of say, well, what is it that we're trying to accomplish in general? So it's really tools to manage patient workflow. And that is the goal, is tools to manage patient workflow. Some of the results of that are increasing waiting times in various settings. ER, physician waiting room, or as you mentioned, some other scenarios in terms of just complicated visits and waiting for different types of specialists. So that's the problem that we are trying to solve. Now, I'm trying to my project manager hat back on. What is it that we're trying, that he wants us to present? In addition to the idea, he wanted us.
He didn't really actually. I didn't really. He just when I heard, he just said present. I think.
I think we are going to present.
Said it's a value proposition.
Actually, this is a canvas model essentially, and
So
whatever
we should-
aspects we
So he wants us to present the value.
Yeah, just to get some ideas going.
Like one of our inspirations can be the Virginia Mason Institute, which is like a large hospital or a healthcare institute, but no waiting room. The customer, as one of you mentioned, like calls in or emails in or has their data already there. Last time I actually did a project over there, so last time we were working over there, we used RFID tags. We gave regular customers RFID tags.
Sorry, what is that?
It's almost like a barcode tag, just a small barcode tag, like attached to your keychain.
Okay.
So what that does is, like our X-ray shop or our medical store, everyone has that scanner with them. As soon as the user comes in, they just scan it so they know what prescription they are running with, or what scans they have to go through. Similarly, the doctor has it in advance, so they immediately know in case of emergency or non-emergency what details they have. Because most of the people who come in are not able to like explain their problems in the verbal form that the doctor would immediately catch. So the whole point was again reducing time. So they don't have any waiting room right now. That's the kind of scenario we are trying to go for, by like reducing these wait times, as you said, like 20 minutes. No need for 20 minutes. It's direct interaction with the doctor and with the healthcare specialist, and attaching a nurse or a caregiver, essentially. And we'll fill those out in our value prop or key partners, key activities, key resources kind of areas.
So in terms of the different, I guess there are different scenarios in different settings. So one is the hospital, ER, and one is a physician's office. Two different markets, two completely different markets.
Yes.
So we've got those two issues, and so when you're talking about the physician's office, the issue is that there will be wait times. You will have to wait for a physician. Yeah. And so what do we do with that wait time?
That we should. Sorry to interrupt you. We should probably be focusing towards that aspect, right? Because I feel the ER is a completely different.
Yes, it's different.
It's a different environment and a different pace of everything.
Yeah, I think we need to think through that a lot more. I think that's another opportunity.
Like a scope.
But again, like what's in scope, what's out of scope. For now, let's say that's out of scope.
Yeah, I agree.
We'll put it on the side.
Yes.
But let's focus on the physician office wait time.
Yep.
And focus on what do we do with that time that a person is waiting. Now, there are two ideas. One is to use the time in the waiting room itself, or to have the use time in the office where they're actually going to see the physician. But I think that doesn't really matter. So what is the content that we're going to deliver while they're waiting for a physician?
Keep in mind that when you go to a physician's office, you spend more time waiting, and you're going to spend more time with the physician.
Exactly.
Can I ask a question?
Yes.
Could you have like a interactive thing for the okay? I'm a patient, right? I went to see my dermatologist, and I'm reinventing, right? And I have the 20 minutes, right? And my dermatologist had this thing. It's like I sit there. It's like computer terminal, right? And you just ask me questions.
Yes, that's what we want to
like,
do. It's survey.
Did your skin is too dry? Was it the skin too dry, or did it itches after you have food or something? I mean, I don't know, but it's something that is related. Okay, that could be an adjunct to to the conversation with the doctor.
And it would be a list of questions that would respond to your previous question. So it would be an AI that would say, if you answered positive to the skin rash, then it would ask a question related to that. But yes, so it would be an AI that would allow you to do that and then present that information to the nurse.
Yes, so the nurse that did the intake, can just do a quick list, like maybe like a dashboard or something, right? Simple things, and simple icons or something. Pop in that, interact, and it's a baked in question, so you don't have to be nervous that you have to type or something like that. But it sort of, I think, relaxes the person, because the person starts on one hand giving more information, but then sometimes sort of jogs your mind and you remember stuff.
I agree, and people waiting in the waiting room get very
And then
nervous.
you use the 20 minutes, right? And you relax.
That's it. I got a great. That's it.
That's the idea.
You basically, all these questions when you go to the dermatologist, all the questions they're going to ask you. Right now, they give you a huge pamphlet with so many papers that you have to read through and answer. How about you just, those things are absolute. Get rid of the papers completely. You walk into the dermatologist office, they hand you an iPad which is sanitized and covered. And once you're done, obviously they could take the cover off and put another cover on. But basically, your name, then start survey. Then
so
at the end of the day, they print it out. I mean, there are no gory pictures or anything like that. It's more in terms of symptoms, in terms of relaxing the patient, but at the same time collecting information.
So here's my other idea regarding that, and it's that what I want to happen when they check in is that they're automatically logged into the system. And so what does that mean? It means that if they had a previous visit, all of their information could come up and it could say, is this information still correct? And they have to authorize that. How many times have you gone to the doctor's office? You fill out the same form again and again and again. All the time. If they had your information and it just popped up and then you had to verify the information, it would be a lot streamlined and a lot better. So again, all these tips are reducing the amount of time and also reducing the amount of frustration in the patient. Which is key. It's like you're reducing their nervous, them being nervous in the waiting room. And they're interacting, they're engaging with what's going on with them and their health right then and there. And so one is these questions. Then you have, if they finish those questions, then you could have customized videos that they could choose to watch or not. So all these little steps would allow them to solve a couple of problems, which is patient engagement and also comfort, and then getting the answer to these questions to help the doctor better.
And it's going to be so much more organized, because I guarantee that sometimes they just go on their phone, forget the question, they call your name up, you quickly put it in. And like you said, I think that plan's going to cut down, like not a huge amount of time, but 10 minutes, whatever it does.
It could save a lot.
And it just adds up.
There's another benefit to that. Like I was working on a anxiety and depression based app, doing the same thing. So before any person goes to consult their specialist, they would be interacting with an app, which asks the question. Instead of them reading the question, the app will be interacting with them, asking them, so what were the things that you noticed, or whatever nuggets that they wanted to say. So that eliminated the aspect of a person sitting in the waiting room, observing someone else and suddenly, relating to that. Because once you're living in the thing, they can immediately record it, especially when they're on their own, interacting directly with that, instead of seeing others interact with the app. And the benefit to the specialist or the physician was they could see all the past data that the person has said. So contradictory behavior, which is a standard sign of depressed people suffering from depression, they could immediately track, okay, this is the path that's it's going through. So kind of like the questionnaire, except not in like a read and study form, but rather an interactive app which is asking you and you're responding, and it will save whatever you're saying in that app.
But won't you also have another section in case?
I use a lot of graphics. The less writing, the better.
Exactly.
I know, but I'm just
This-
saying, like having other, you know, when you have your survey,
Yeah.
because sometimes even the list that you have might not have exactly those symptoms
Mhm.
that someone is experiencing.
Okay,
But
yeah,
having
obviously, yes.
questions, but
Always
also
having something that's other, and also maybe even a place for them to write.
Yeah, that's what I
They
mean.
they could communicate as much as they want beforehand.
And you have to streamline those questions depending on what kind of office they're going to. Someone going
Yes.
to a dermatologist is different from someone going to a cardiologist.
But still, you know, like right now, every kind of different doctor.
We
gives
use
you
that
those
other
questions.
we use that
Yeah,
other
do you smoke?
answer
Do
for
you
text
drink?
analytics. Essentially picked out words that the person emphasized on, you know, repeated again and again. So the doctor can immediately pick it up, what they're trying to say. You know, even the patient cannot explain it very well.
I mean, people are much more comfortable with technology now. And that is what makes this possible. That is what makes this group and this type of idea possible, where it's, you know, 10, 20 years ago, it wouldn't be feasible.
Can we still think of the idea that we are reducing the size of the waiting room? Essentially, these things can be done at home. If someone wants to book an appointment, because people would rather book an appointment and come on time to meet the doctor rather than sit 45 minutes in the waiting room.
Like a pre-check-in at the airport, you checking out,
They,
come by.
once they have already
Checked in.
been to the doctor's office once, they already have their file on top.
Yeah.
So they don't have to re-enter everything.
So I think that is the eventual goal. The goal is to have as much done before the visit and to have the waiting time eliminated completely if possible. But I don't think that's currently 100% feasible. But it's something that, you know, we want to add to the list of things that we want to do.
That is our eventual goal.
That would be the eventual goal, yeah. So, but in terms of the pre-check-in,
because as long as you have number of chairs, say number of chairs is a physical representation of how many people we want in the waiting room, people would continue to use that system.
But is it?
But depends
From the
what
airport-
depends what you need the doctor. Okay, let's say if I'm just going by to see my eye doctor, my ear exam, it's one thing. Then someone that has some infection or losing vision or something, it depends. What case by case.
I have a question.
Sure.
So what you're talking about is just a platform, right? So
Yes.
it can just be an app. So I don't know how it's different because right now, like my doctor, for example, they have an online patient portal.
Yeah.
So
and that's where
we can communicate whilst I'm at home. I can send my doctor a message and say, hey, I'm experiencing this. Do you think it's serious enough for me to come in, or does it have anything to do with my current medication? So I'm just confused why it's not feasible to do at home when that same platform, I'm not saying don't eliminate the wait room, but I'm saying obviously you have your iPads or your tablets in the doctor's office. But if it's simply an app that's associated with your healthcare provider, you can also download it for yourself. So even if you're running late as well, you don't create this lag time for people in the waiting room.
So you guys are selling me, and so I'm hearing that too.
Yeah, so
I like the analogy of the airport check-in.
Yeah, that's
because that was my concern at first. My first concern was that, well, you don't want to give somebody that much power like a week beforehand, and a week before the appointment, things are going to change. But airport check-in, it's like 24 hours beforehand. Okay, then if you put a time frame around it, it makes more sense that you can respond to these questions. But so that I think that's good, and that's something that I guess the question is I'm trying to triage it as to where to put it. It's like I know that the waiting room is an issue, and where you have to market, you have to sell your idea. So which one are we going to market and sell? Which is going to be the most profitable and the most helpful to people? Is it reducing the waiting time in the waiting room, which exists, and they exist all over the country, or eliminating the waiting room, which is, I think, a bigger lift? So whether it's a basic app or not, I think even if you fill out all this information, you're still going to go there, and you may still have to wait.
Can I tell you something? May I suggest something?
Sure.
When it comes to waiting rooms, this I know for sure because I've worked with a lot of doctors who have their own offices. before you even go there, you have an appointment.
Yes.
At 1 p.m., the doctor is seeing you.
Yeah.
So that means even if you drive in 15 minutes before or 10 minutes, even if you arrive 5 minutes before, and your appointment is at 1 p.m., that means that doctor, on that doctor's time schedule, he's seeing you for 30 minutes. That means there is even no time for you to even wait.
So you have to wait to fill anything out.
So the wait time is in the emergency room. Go for the big apple.
Emergency room.
If you're going to
someone, it's emergency room. It's a completely like you got to figure out how many people are walking in versus ambulance. Like you got to get those numbers.
Well, no, the ones who come in, not the ones because the ones who are brought in by ambulances, that's priority. You go to the back.
That's not true.
You already have
That's
like
not true. That's not true. A lot of people call for like basically bullshit calls. People who don't want to go to work the next day, they'll call in like, "Oh, I fell or something," and like there's like a lot of calls you get are frequent flyers, and triage happens in the hospital. The doctor comes or nurse, they look at them, and that's how they put triage.
Okay, so let's agree that there are different markets and different places that we could improve the wait time. The biggest issue is ER, which is the longest waiting times.
Yeah,
obviously. So that could benefit from some of this. So, but is that what we're going to target first? Is that what we're going to target first? I'm not so sure. So, but it's something where it's on the radar. We're going to work. We're going to work.
I want to
Yes.
say something. So the suggestion of doing these things at home
Yes, I'm listening.
is not to completely say when you get to because you've already suggested that you will have some videos or something like the same way right now waiting rooms have magazines, crossword puzzles, and stuff. But I'm just saying, if you're running late, you don't have time to be in the waiting room either.
True.
And then you get to the doctors, you forget your symptoms, and all of a sudden I don't know what psychological thing happens. You walk into the doctor's office, you feel completely better. By the time they're talking to you, you're just like,
You forgot what it was.
dude, I think I'm good. So that's why I don't think there's so much of a difference between this platform being available just in the doctor's office and it being available at home. But the way you've also suggested an entertainment section just to calm people down. So they're not mutually exclusive or you should run it out. But I'm just saying that the platform should be accessible for people outside of the doctor's office. It's just that the doctor will have iPads and stuff for people who do arrive.
So the goal is multifaceted.
Yes.
And the benefits are multifaceted. So the way we would present it, the way we will present it, we are going to say is we are creating a platform to engage the patient, to visit prior to their appointment, whether that be 24 hours beforehand or whether that be in the waiting room itself.
Yes.
Okay. So that I think works. So it's a platform that works on a couple of different levels. One, they would be able to access it from home. Two, they would be automatically logged in to the system when they are registered, and they would have a tablet given to them for the visit. And that would, if they hadn't completed the questions, even if they had, it would list them, give them a few additional questions and other options to entertain or to get as much information to help the visit as possible. So, so yeah, I think that's doable.
And then a byproduct or by result is it also cuts down on the visit time itself with the doctor because they can sort of narrow down that this is what you're actually suffering from.
Yep.
Okay.
Okay. All right. So I think that works. So the initial market that we're considering is the
primary care.
It's the primary care market. So that's one. I think I will mention that, you know, the group also discussed possibilities of reducing wait times in the emergency room, which is a huge issue and which would be an automatic outgrowth of this process. Again, we would have to develop our own workflows, our own questions, our own, determine how much of this would be AI versus how much of it would be
us just designing survey questions, and whether, the steps of how that would, what that would take.
I have a
suggestion.
Yes.
Well, you go first.
I've never been to the ER in this country, but I know a lot of people.
Congratulations.
Let's keep it that way.
That sounds broke too, but I know a lot of people always consider how expensive, for example, getting an ambulance is. But with the app, eventually, if it picks, the platform, if it generates a lot of interest, it could also be helpful for people who don't want to be in an ambulance, so they can be logging in the symptoms, you know what I mean? And then, what did she say about intake and stuff? So that by the time you arrive at intake, patient has a name. Because what it can do is it can recognize the nearest ER facility for them to go in, and then they're logging in as they're traveling to that specific facility, and then entering details, so that I feel like that could be the potential reduction in wait time. Not necessarily eliminated completely, but if you were not in an ambulance with some EMT person helping you out, the person who's driving you could, not driving you because don't drive in Texas, but someone who is accompanying you, or even you personally, if you were not dying physically, you could enter that. And it might even eliminate those people phony callers because,
So when you get a call, is it
you have to go?
So I was gonna comment on that when you said about like you put in a form when you talk to a doctor. Well, I've had patients myself who they call the doctor and they say, yeah, I have chest pain, this and this. First thing they do, call the ambulance. If they don't call the ambulance, there's been times the doctor will call us and say, listen, send an ambulance to this household. But when it comes down to billing and stuff, I know you mentioned it's different. I mean, there's a lot of times, people use the ambulance all the time in bigger cities, don't have any money. But if you use a portal and stuff, the doctor, if you having chest pain, doctor will not allow you to will highly disregard that you have a family member drive you to the hospital. And you said the nearest ER. Usually when we get to the scene, it's usually up to us to distinguish where we think is best for you to go.
I've never used that.
Yeah. I'm just trying to let you know how from my experience how it usually works.
And you're not calling it. Are you calling the ER ahead of time, letting them know you're arriving?
Yeah. You have 5 minutes right before we come in. We call the hospital, and they put us. We call for a CMED, and then they put you in touch with the hospital and give a report. And then if you have any further questions, and then the attending nurse usually responds, and she's like, "No further questions. See you in 5 minutes."
Okay.
All right, you had an idea.
Yeah. Regarding the questions, I walked in and you were talking about, whether we should come up with the questions or whether you don't need to do that. You just walk to the let's say dermatologist, the office. You ask them for the questions
that they ask. Yeah.
Do you smoke? Do you drink? So those are the questions you use.
Okay. No, that makes sense.
And they're going to be different. If you go on with this,
it'll be different with every visit. That's why you have to have, and also, but that's what I'm saying is that you have an intelligent engine behind it that, in addition to the questions that they might ask, it could lead to more specific questions, even beyond that.
This is even better for you as the developer. What you just mentioned, you're going to have to come up with different packages. So, for example, your AI, for example, if you're giving an AI to cardiologists, this is going to be the cardiology package. You don't bring up, apart from the basic questions like, do you have any history of heart, chest pain or whatever, you don't bring up questions that you would find in the neurologist's office. You get what I'm saying? So in other words, the questions should be streamlined, or the AI should be streamlined for that specific package, just for cardiology and
it's also streamlined on the doctor side, for the cardiologist side. It would highlight, even if there were 20 questions, that highlight these are the 3 questions you really need to pay attention to. So again, but yeah, just that's good. I mean, it's specific to the task at hand, if you will.
You're gonna have to talk to a lot of
Yeah. The kind of research we did for developing that kind of an app was we interacted with hundreds of doctors, and it was like we essentially simulated patient case scenarios. We had to interview patients for like a whole day, to essentially identify what kind of questions to ask them, what is the best way to ask them. Like,
and what facility was this in?
This was part of Northeastern University's research. So we were collaborating with Tufts and doing that. So.
All right, great.
Then one thing that would be good to know, but I don't know if it's possible. For instance, let's say you have an appointment with whatever doctors, 10:30 in the morning. In reality, the doctor knows that he's not going to be seeing you at 10:30. He's going to be seeing you 45 minutes later.
Yes.
Right. So you have two parallel schedules, right? And the thing is there a way to make this schedules, closer?
There's a tool that does that.
I want to add on to something she just said. That is true, but it also depends on some specific doctors, because I shadowed a cardiologist who had a very tight schedule, 30 minutes, another patient. So it all depends on what kind of doctor, because one doctor might see one patient, like 6 patients in a day, and another doctor, the one that I worked with from Mass General, he used to see like 20 patients a day. 30 minutes, all streamlined. You miss that 30-minute slot. I've seen people who had to be rescheduled with another cardiologist. It depends on the doctor.
But doesn't that also depend on the patient?
I don't know. I never seen a thing like that. And I mean, and my doctors have been the last almost 40 years, all Mass General. Even if it's 30 minutes that they had allocated and they need to be 45, it goes to 45.
But that's what I'm saying.
Or an hour.
Yeah.
It's not at 30 minutes. It's maybe let's say a standard, interaction is, let's say, 30 minutes. But I think it's case by case. And that's why at the end of the day, you have this accumulated weight, right?
Mm-hmm.
Because there is people that they're going to be seeing it and
Yeah.
resolve in less than 30
In
minutes.
some offices,
in others, it's going to be way
it's
more.
a worse problem. It's a large problem in some offices rather than others. But there is a program, and you have to talk to Cal about this, about managing that wait time. But I don't know about the specific issue. What were you going to say about it?
I was going to say, but isn't the whole us asking these leading questions going to cut down? Because it depends on the patient. If I come in and it's very obvious I've got a cold, the doctor and I are not going to sit for half an hour asking, so tell me more about this cold that you're experiencing. But if people are having trouble really trying to diagnose this person, but if you've already sort of answered these leading questions, isn't that cut down on the time spent?
So ideally, it would facilitate the length of time of the appointment. But there is something to be said about not allowing that appointment to be too short. Because if it's less than like 10 minutes, 5 minutes, the doctor can't take advantage of the fact that he has most of the information. He still has to develop a rapport.
No, I understand, but you know how he's saying that certain doctors will streamline and say
it would save a lot. It would save them some time. Yes, definitely.
It depends. Surgeon.
And it should reduce
Surgeons
the
will
wait
talk
time.
to you for 10 minutes or less.
That he was a surgeon, yes.
That's what happens to surgeons, okay? My hand surgeon is a genius. I love this man to death. He is absolutely a genius, okay? In fact, he's the main reason that Boston had Mass General, Brigham's, and all those hospitals that were top fly when the bombing happened. He was the cause. He was the one who, out of Mass General, got everybody reorganized. He has a huge team, okay, and the workflow has been fractioned with different different specialists that has to see you, right? So when it gets for him, he's the last one. He gets all this information, okay? You have been seen by every person of his team leading to him. And he just walked in the room and said, we're gonna have surgery day X, let me check this, check that. this is this is that, and this is what we're going to do, and blah blah blah. 10 minutes.
10 minutes.
He's in and out.
And yeah, some of the specialists will take
so
that by time.
and I have seen this happening with lots of surgeons. Okay, that they're doing that.
Okay.
That they have
that's-
streamlined the interaction.
Yeah, I think I'm not sure where we're going now with this. So,
You
okay.
need to account for all that because that's how it goes down in a real surgeon's office.
Okay, so, but where are we going? I know the problem, I see the problem, but
But
what's,
we only do clinicians, right? We're talking, general
Mostly
clinics,
doctors.
right?
But this
That's
is
where
just
the
going to
biggest.
come in, right? This is, I mean, just to get information in.
Yes.
That's why I'm understanding, right? And then where the
Yeah.
information goes, that's what the nurse, that's
another workflow.
That's another workflow.
And we do have to keep that in mind, and we have to make our workflows fit into their workflows, so that's something key. But what were you gonna say?
No, I was just saying, like you just say, make your workflows fit into their workflows.
Yes. Oh, I mean, there's no way you can work or market your product to physicians and to physician organizations without being clear and understanding their workflows or working with them to listen to what their workflows are. Agreed.
I
Agreed.
have
Yes.
one sort of suggestion.
Mhm.
Especially if the platform can be accessed from at home.
Okay.
Also a way to rate how your doctor did. Or just rating your whole visit
Rating
so
the
that
whole visit.
there's this
Yeah,
analytics.
so now we're at after the visit.
Yeah, I'm just
That's
saying, like, for
post-visit.
us to have feedback, you as a developer, you have
Okay.
constant feedback on how your
could be-
application
Yeah.
keeps helping out or how it keeps messing up. Just a short little thing
Post.
so that
How
people.
would you guys, I'm curious on everyone's input, what would you guys think of, like how would you guys get information from, it's just something to go off, would you have to go off and ask doctors, clinicians to see how they're using their time, or what would you think would be the first step to kind of collect data, just kind of have like numbers to kind of play with it?
Talk to as many doctors as you can.
That's what I would think,
That's
so.
that's the
That's
first
step
thing is to
one.
talk to physicians and try to get that information.
Oh, and
Um,
also the ladies, the intake people, like what is the average wait time for people in, because they're the ones who.
But it's also good to talk to the intake people just to say, what are the types of issues that you experience?
Yeah, and
during
also-
intake? Because they might know some things that the physicians, they don't, and they're not doing intake.
And also asking, like, on average, how long are people waiting in this office?
You're absolutely right on that.
Yeah.
Yeah.
Because I mean, like, doctors sometimes just don't know what's going on because they get the chart, so and so's coming in, and they come out and they're like, so.
But we've all had experiences in waiting rooms. I've had to wait a very long time.
Yeah.
And there's two wait times. There's the wait time in the waiting room, and then once you get to
the
room itself,
Yeah.
you also have to wait for the doctor.
Yes.
So I mean, that's what I'm trying to combat. I'm trying to combat the feeling that
unwantedness,
the fact that you have to
which is the
wait.
worst disease. Which is horrible.
I think also the point of you putting your symptoms, sometimes if they need to take like a urine sample, for example, then that person who collects can just say, hey, go in there, take your urine sample, and then like we'll take your weight, your blood pressure and everything, and then because it cuts down a lot.
It does cut down on all.
The second wait, I think, is the worst one.
It is the worst one.
I know.
You're about to get there, it's gonna be good, and
You're
boom, you get
chicken,
another
especially if you have to disrobe.
Yeah.
It's so cold.
It's cold.
So yeah, and again, it's just about engaging that patient and making sure that they feel as comfortable as possible with their care, and that it would improve the ratings of that physician.
It would.
It'll improve the rating of the physician, and that's a huge marketing thing that we could use.
So
we got some good stuff down here.
We are having currently the same platforms which we are discussing. Like there are two applications. Say you are a physician, you have the same application. I am a patient, I am having an application. I search a location like for the in here like Boston. So I will get a list of the doctors. Then I mention the problem for the eye specialist. So it will like show me the eye specialist here in the location. Then I can fix a schedule an appointment. So there are some platforms who are doing this type of work which we are discussing. So we have to like introduce some innovative concept to make this.
So the way we are different is like we are trying to make it more personal. First off, like all the information based on patient history, the number of times they have came in, and each person has different like blood groups and allergies and everything. So we have a maintained database. That's what our interaction with the iPad is doing essentially. And she was absolutely right about getting more knowledge from the wait staff, because essentially time with the doctor is expensive. You cannot interview them as much as you can do with the wait staff, and every single hospital actually sends you, how was your experience, please rate within 5 minutes and all that. That's a mail that they send. What's more important is as soon as the patient is exiting the physician's office, a person personally interacts with them. Basic 5 questions, and that's the real interaction that you're getting, because they are not thinking, they are not able to forget, what just happened with them or the kind of experiences that they have. So for your question, it's more about our application or whatever value that we are creating is more personalized and record kept, and it directly segregates between emergency and non-emergency. We are targeting non-emergency in our case right now. So we are developing towards something more personal. And yeah, sorry.
No, you just triggered an idea in terms of workflows.
Yeah.
So if we are indeed improving the wait times and reducing the amount of time it takes to meet the patient's need, why couldn't when they leave their appointment, the intake person say, if you have a moment, would you be willing to answer a few questions? And they could actually do it verbally, or give them the pad again to do it.
That's what we did at Virgin Amazing.
So you did do that.
Yeah. So this is actually part of lean engineering.
Okay.
This is also basically what it is personal interaction. You see the person and you note down what they're saying. At the same time, note down what's around them, what's happening. That's how people know 45 minutes is the average wait time when you go see a physician. Even though you have done all your homework from home, many hospitals do have that iPad check-in and everything. They have portals that you can log in and detail everything. Yet you have to wait at the waiting room for 45 minutes.
I think of all these weights, I think the second weight is still the one that is the more difficult to solve.
Yeah.
Any ideas?
So the relation between the the relation between the first and second weight, the second weight being more painful because the person is more hopeful, is information overlap. The wait staff don't know where the doctor is at any point of time. Why would they send you to another waiting room? If they know that the doctor can treat you at a very specific time, there's a clear communication gap over here. So to reduce that gap, that's why they don't have a waiting room. It was They eliminated that. So the doctor is responsible, not that the doctor himself is responsible or themselves is responsible. Their direct staff is responsible for scheduling each and every half an hour or 45 minutes or whatever interval that they are comfortable. So person's data is there via our app or iPad or whatever medium that we are using, or maybe a dedicated nurse, whatever we are using. The doctor is, the information of where the doctor is and when they are going to be at some point will be with the wait staff, which is currently not there, which is why there's a huge waiting line in the second waiting room, where you're isolated, you're scared, you don't know what's going to happen. And yeah, it's a petrifying time.
I mean, ideally they would be able to take the pad with them to the room to continue to interact. And in a real ideal world, it would say estimated wait time, so they could check on their iPad. In a real ideal world, it's possible, but it's going to take some time to do that. Okay.
It's called the quality service.
If you could really eliminate the second weight, that would be perfect.
I mean, but
that is where
let's take the physician standpoint. If I'm a physician, I want to make sure that patient is ready for my visit. So I need to make sure that they've gotten into the room and that they've had a chance to disrobe if necessary. So there needs to be some time allotted for that. And I think that's where it becomes a communication between
the wait staff and the
intake staff. But it could also be that they had the iPad in the room. Boom, I'm ready for you now. They put it on the iPad,
I'm ready for you now. You know, and
that's where the second wave stuff comes in. Because they are going to ascertain that the patient is ready, because every patient would say, oh yeah, I'm ready, I've done everything, and the physician comes in and they're like, you didn't do it correctly, or you didn't do it at all. These are the things that were required, say blood pressure or anything, you know, basic stuff, disrobing sometimes. People don't know how much they have to remove and stuff. So that's where the second wave stuff comes in. You know, that interaction comes in. Yeah, we are absolutely on track with the eliminating the waiting time. But as you said, identifying the second waiting time, why is that being, you know, there?
The second wait in an actual doctor's office, leave alone the emergency room, because the emergency room you can get in and still wait for 30 minutes.
That's another wait.
The second wait in the real doctor's office is like 5 to 10 minutes, not even 10.
That's not always the case. It depends. I mean, you've got a large variety of different physicians' offices, and a lot of different wait times. I've had to wait in a room for half an hour, 45 minutes.
What specialty was it? What?
Just a primary care, primary care visit.
Depends the area.
Because now, because when you're talking about internists, the cardiologists, the vascular surgeons, those people have their time streamlined.
Well, the time is much more expensive as well. Yes.
Yeah, but you are right. You are right. I do agree with you that it also depends. What if like you're a suburban environment versus a city environment? Like it's completely different. Like you go to, let's say, New York, or Boston, for example. You go over here at primary care. I mean, it's easy. You can wait 30 minutes.
Yeah.
There are people because doctors, they take their time. You know.
But, and they are overbooked many times.
They are.
And this is what happens usually. If you have an appointment at 1 p.m., the doctor in a doctor's office is going to see you within the next 30 minutes. That means the first 10 minutes you're filling out the paperwork, which hopefully our software is going to eliminate. We'll hope. Yeah. Then once you get into the room, once they call you in, first you speak to the nurse practitioner or the nurse. That's another 10 minutes. Then the nurse says, okay, the doctor is coming to see you. So what happens is that the nurse goes to the doctor's office. He's like, oh, this guy, what's wrong with this guy? He's always here. They chit chat just a little bit, 2-3 minutes. And the doctor comes in, hey, what's going on? So you've waited for primary care. Okay. But the doctors that I've shadowed who are, you know, the internists, higher level internists, those people don't waste time. You know, you wait for only 5 minutes.
But again, the larger market is the primary care. So we've got different markets that we have to look at, different markets that we have to address. So the issues for a cardiologist or higher level internist, we'd have to address those. So you're saying there may be less time
yes.
for them to fill out all this information. That's okay.
For the higher level internists.
You are being seen by their team. And therefore, the information can be all parsed, right? And ultimately, your time is occupied. It really becomes, disappointing when you go to do the primary care, which you have this big wait. You wait in a front office, and they do a little intake, and you see it, and this and that, and then okay. Come into the office and you disrobe, you get prepared. It's going to take another 5 or 10 or 15 minutes for the doctor to come out, and then it talks 10 minutes with you. And
not even 10. Yeah. You're right. Yeah.
And so that is, how much of these interactions can be done, as you are suggesting, through AI, some kind of, big questions or something, or I don't know, talk with your doctor online or something.
And again, it's as you suggested, we talk to the physicians, we talk to them to develop the questions or just get their questions so that we can streamline the workflow. Anything to make the visit easier, quicker, more informative, and less frustrating for both parties. And that's key. How do we sell it? We sell it by telling physicians this is going to be less frustrating for you because you're going to have more information up front, and the patient is going to be much more calm and comfortable and engaged in what's going on at that visit.
Well, one thing to ask, I'm sorry, to ask the doctors is that if if we have the patient occupied in the first wait and you get all this other information, we can diminish the second wait.
Currently, it doesn't.
It does not, yeah. It's hard to say.
Because communication gap again. First wait room, second wait room, staff are different.
Yeah.
Even though on paper you have every single data, how many times they visited every there's no real connection when a person is going to finish that. So the starting point would be changes in the physical interaction with the doctor.
Ideally, yes, right? Again, to eliminate the wait room.
Because it's not just an IT solution, it's actually something that's physically there, someone is experiencing.
Gigi?
Of course,
yes.
How's it going? You ready to present?
Sure.
Okay, great. It's okay, don't worry if it's not 100% bulletproof.
Let's see what can you. I threw him in there.
He works at a biotech.
Thank you.
I have some colors too.
He wants to go to med school.
See my projects.
So we were
Yeah, I wanna
working
hear
on
more about,
this,
what you've been doing,
reducing
so.
wait time.
I'm currently looking for
The
new
doctor's
projects and stuff. Essentially, I want to be a program manager.
He works, he's gone to school or he's done?
I'm all about
He did his undergraduate in
Are you,
biology and neuroscience. And now he works at a biotech company that does brainwaves.
We'll touch base after.
I think it's helpful, but I'm still.
I would say
yes.
innocent.
It'll be helpful when I get a new position. That's what I took. That's what I'll say. It's really helpful.
I don't have enough experience under my belt to appreciate a PMP certification right now. That's the reason I didn't get
I'm into drugs though. I'm into drugs.
I would be
I
part
don't
of
know if anyone
the
tried them.
Yeah. Yes, this is what we're gonna do. I'm gonna give you training.
Where am I
I'm gonna connect over the next week. Are you Boston?
I'm right here.
You were right here.
What are you looking for exactly?
So, I'll no, I got to have a meeting with actually another guy. With me. Business meeting tomorrow.
Give me,
Here, I have let me give you my notebook and you can write in my
marketing and sales team to make
I do have a card.
You can write a backup district, basically, that way.
The R&D has to be the customer engagement.
Okay. And healthcare is what you're.
Actually, I was using my business card.
Oh, you
That's
do?
different.
Yeah,
Well,
business
well,
card.
I have I don't need
industry and the
business.
consumer goods industry. I'm looking more towards the consumer interaction side. So healthcare is one great part. Okay. So in healthcare, product development is much more acute. You have to follow a higher level of quality standards. So I don't have that much experience in that.
You might.
It's the best way to reach me.
Some of the.
Great. This is my card.
Okay, sure. So let's get together and see what we need.
Yeah, and we'll talk more about when I love to talk more about the security type of stuff.
He's one of the most, one
I
of
love
the, I think top 10 educated president in Africa.
But he sucks.
That's different. And he actually mostly went to African universities for his education.
But he's a horrible
We
person.
just had one that was, I didn't get to go because I had to interview the next day.
Back on the firefighting is also valuable to us. So we have,
I think
we have been
there might be
looking
some
at
knowledge, but most of them.
Yeah.
I would say if you talk about me,
And it's gonna have a lot of
Talking
different
about-
EMS in the hospital. There's a lot of room for innovation.
In the real world.
And I see it myself working hand in hand.
So that's why I knew that I wanted to do
Yeah.
in the future.
And what I can offer is if any
Sure.
connections with others, we just talked about programs for doctors to use.
Oh, yeah.
We're gonna go on the golf course tomorrow, get in touch with the surgeons and help them out with us with these ideas.
Yeah, let's work on some.
Definitely.
All right. So do we have enough doctors here that if I had a heart attack right now, I'd be okay?
I know how to use a defibrillator.
Two cardiology fellows.
What is this detailing stuff here?
Oh, so I opened that business 2 years ago. So what I do is I take Porsches, BMWs, they bring them in, and I base polish them
I see.
and make them brand new, prevent rust and stuff.
Okay, as soon as they got connected.
Where you living these days?
I'm living next to the park. I release.
Okay. Excellent. I'm in Woburn.
planning to get my license and then move out probably. To run away quickly.
Wait, when did you graduate?
May 2017.
Oh, just now.
Yeah.
Northeast.
Nice.
On the thesis grade school.
Yeah, it gave me good experiences, yes.
And what was your degree?
Masters in Engineering Management, focused on product development.
So, 2 year?
Yeah.
2 year? Yeah, I'm looking for MBA schools.
Yeah,
I've been looking
so
at
they
that.
have demo thing, which is good. I tried going for the tech entrepreneurship courses. They are fun.
Are you involved with any like the technology stuff around like MIT or anything? You attend the investment conference, not investment, like they have a lot of innovation conferences. Have you attended any of them?
Yeah.
Super interesting.
Yeah.
What kind of?
So there was a fintech conference.
Oh, I missed it.
And
when was
that was a good one I
Yeah,
attended.
when was
There's
that?
actually Harvard's having one.
We run our own hackathon. That's what probably.
I suggest look through the events of these big schools.
Yeah.
Buy the ticket. 100% worth it.
I do that.
Yeah. And if you want, I can help you get in touch with some people.
All right, guys. So let's get started. Thank you so much.
Yeah, I'll get you.
So who's going to present from your side? From
Language? Okay.
Are you ready?
I don't think we have enough people
okay,
here yet.
sure. Okay, that's fine. Whatever.
We're just gonna go with it.
Yeah.
Yeah.
All right.
Everybody loves
Problem, was a different problem you were trying to solve.
Yeah, we solved something else. Okay.
All right. What is the problem you can solve eventually?
All right. So, the problem that we're trying to
Mohan, can you?
Good job.
okay. The problem that we're trying to solve is wait times in physician offices, primarily primary care settings, but we've explored a number of different options. So what we really started to develop were tools to manage the patient workflow. And the goal is to engage and to calm the patient as much as possible before the appointment. Either it could be in advance, sort of as a pre-check-in, as they do at the airport. The day beforehand, they log into the system and input the information, input a list of answer some questions that would normally be answered in the setting of a doctor's office. And they could answer questions, and it could be either questions that a doctor would normally ask, or it could be an AI in terms of responding to their symptoms and asking additional questions, taking them down a specific route. So one solution would be before the visit, and then the other solution would be at the visit itself. If you're in a waiting room, you may have to wait 10 minutes. You may have to wait 45 minutes. You don't know. But you would have the option of you go check in at the front desk. You check in at the front desk, and the intake person would automatically log you in to their system. At that point, they would give you an iPad, and you would be able to, if you haven't answered those questions the day before, you'd be able to answer those same questions during. If you did answer those questions the day before, you'd have additional content regarding your condition or videos regarding your health in general. And so you'd be able to interact and be engaged in your care while you wait. A lot of people get extremely nervous during that wait time, whether that wait time be in the waiting room itself, or as we discussed, the second wait time. A second wait time is when you're in the actual physician's room and you're disrobed and you're like, where is the physician? If you had a way to interact and be engaged during that time, it would help the process. Now, there's another side to all of this. The other side is the actual information that's gathered during these sessions. What's done with that? Does a nurse or an intake person have access to that? Can that information also be given to the physician? So let's say, for example, you've answered 20, 30 questions. If the system was intelligent enough to say, give that information to the doctor, but say, highlight, these are the questions that you need to focus on. And also have, that person may have entered at the end, they have another category where they can just write in notes as to what they want to give, what they want to tell the physician regarding their conditions. And we talked about some scenarios. So for example, somebody is prepared to go to their visit, and once they get there, they forget what their symptoms were, or something, they get nervous, or they just are caught up in their day. This is something that allows those frustrations to be minimized, and also something that will decrease not only decrease the waiting time of the patient in terms of what they're feeling the waiting time is, but actually it will actually decrease the wait time if the physician has a better sense of how they can interact with that person when they get there.
Let's see. Very good, very good.
All right, so that's the general gist. Any questions?
Yeah, definitely. Now, some of the electronic medical records are already doing this, and people have access to patient portal.
Mm-hmm. Yep, we discussed that. Yeah.
Yeah. So why I think that is there, so people can fill out questions before even they get there, and these electronic medical record systems automatically send an email reminder and give a link about filling what questions do you want to ask and things like that.
So let me just give you another.
No, I'm not killing your idea. I'm just talking more so that we can come up with a unique value proposition.
I was going to add more as well, but go ahead.
Okay, go ahead. Is there a unique value more unique value proposition?
Well, I think it's along the same lines. It's like if you're going to a physician's office and you have those standard questions, this is a way that when that patient gets there, you present them with the answers they had the last time, and they just have to validate that those answers are still correct, versus having to input the same information again and again and again, which is just very frustrating.
What is your...
Well, 1 second, I just wanted to. One of the unique value proposition I saw was, I heard was AI bot, AI, because it's asking adaptive questions. That's very important, and it's also asking contextual questions, looking into the health record. It's just not asking same questions for everybody. It's customizing and adapting. And so that is something unique. I've never heard of that. And people are already giving iPads and videos. That's also there. But yeah, that's my thought.
Okay.
So what are some of the testable hypotheses have you come up with? And what is the testing plan for that?
We have not yet come up with a testing plan. We did talk about who we want to approach in terms of getting additional information. So, example, we want to talk to physicians, but you'll also want to talk to intake staff to get a sense of what are the issues that they're facing day to day, so that we can develop the idea further. But that's where we're at.
It's good. I mean, for the starting, as I said, it's good, but you should think about your value proposition and the customer demographic stuff. You should always think about what is the testable hypothesis and what should be how we are going to test them and what's the result. And that's a shift in paradigm. The way you think is all fun and nice to say, okay, these are things we can do, X, Y, Z, etc., etc. But step back and say, am I talking reality?
One of the things that we talked about were post. After the visit, what do we do post? So, for example, we had an example from another organization that Virgin, and it was when the patient leaves, they have the option. The intake person would say, "Do you have a moment to answer a few questions?" and would either take those verbally or give them the pad to do so again. And if they didn't do it at them, they could also finish the survey questions at home. But that's that's something that would be testable. You would be able to at least gauge the patient's satisfaction.
That's not the test I'm talking about. You're selling something. So you say the fundamental assumption is whatever you're selling is a need.
Yes.
Because there's a customer who wants to pay for it. That's an assumption you're making.
Okay.
That you have to test, not that customer. Okay, you have customer perception, but you have to ask, okay, it's going to be, if I build such a thing, would you buy? And what kind of problem am I solving? Is that a real problem?
And okay,
many
so
times you'll find that many times you build some product happily and go back and find after that, oh, there's no problem here. We are happy with whatever we have. We don't have any problem. Then you're in the limbo at that stage. See, that's what you're trying to avoid.
Okay.
So we'd have to find a way to test that, and I'd have to think about how it would meet the need.
What problem are you solving? Simple. Ask your simple question. Whenever you say something, I'm going to do X, Y, Z. What problem am I solving? And is there such a problem?
Yeah,
Talk to 10 people and know.
it's the frustration of the waiting room. It's the frustration of the patient in the waiting room.
One thing I understand.
That's one.
But here is a situation where you have to be very careful about your, one's own thinking, blind spots. Ask around, talk to people, and see if there is. There may be, maybe not. I don't know. But checking that is the foundation. That's the whole purpose of premise of this.
Yeah. So in terms of financially, I'd have to think about this a little bit more. One, we would be improving. Ideally, we would be improving the satisfaction of the consumer, so that the patients, the providers would have better ratings. That's one. But how else is this improving the finances for the physicians and the physician offices themselves? So that's something to think about.
Increase the number of patients that can visit per day.
Definitely. I think what we can do is that we can start. This is my thought. AI bot where we collect all the information, pre-visit information, and as we collect this, then we'll have enough patients. And one of the revenue model is like ZocDoc, fill in appointments which are available. That is a known business model, and yeah, that'll work. So I think chatbot would be a great idea to collect this information and online reservation from there.
So how is this going to save the doctor's office money? That's my new question.
You're getting new patients. That's what
question.
It is. You're getting new patients. That's new patients is more money.
How do you know?
Huh?
How do you know?
I know because ZocDoc is one of the most popular businesses out there. One of the successful healthcare businesses out there.
So what's really the point of this creation? Is it to fill the appointment slots? Is it to create customer satisfaction? Or is it to put money into the pockets of these doctors and facilities? What's the truth?
So the patient is not your customer. Physicians are. Because you're selling that product to the healthcare health providers. So they are your customers, not patients.
Agreed.
Yeah. So to his customers, what he's bringing is new business, increasing the bottom line, more revenue. Yeah, that is a value proposition.
But one thing that could help a lot it is in terms of medicine's compliance, because sometimes the patient feels very embarrassed to tell the doctor that they have to take it all the time, or all the things that come in between that people don't comply, they don't follow the regimen.
That's true.
But if you have, let's say it's almost neutral environment, let's say, I didn't take it all the time or whatever. I think people feel more freer to give the information. Otherwise, you just say, no, I took it all the time, blah, blah.
Yeah.
But if
I see.
But it also improves the experience of the patient because, like I mentioned, if you forget what your symptoms are, and also it reduces the time. Like with your doctor does not have a computer in his head, so trying to narrow down what you're really suffering from or what additional tests you have to do, it will cut down on that time for the both of you.
Definitely.
So my next question with this creation, because you're going to be utilizing iPads.
That's one thought.
That's one thought. Disabilities and people with disabilities and frustration. How is someone who's blind going to use the iPad?
Well, that's not relevant because they're not going to be interacting with the iPad. They'd be interacting with one of the intake staff. So it's not for everyone, obviously. So it would be used in situations where it would be appropriate.
And also, it's not eliminating the intake staff because if you show up to a doctor's office, you've never been there before. Obviously, you don't want to just walk up and only see machines and screens that you don't know where to approach. It's still going to be someone who's accessible. So even if you're having trouble with using the app, or you're not into using the app, you still have this intake staff who's going to walk you through the whole process.
Yeah, but have you guys been in that situation where you needed the assistance of an intake staff, but there was only one and there was 10 other people?
Which is why they have the app, because that one intake staff is not catering to all 10 people.
Yeah, but this is what I'm saying, they are.
You press
have to
the
wait.
you press the help button and someone comes up.
This is what this is also doing. It is streamlining the process so that the intake person can spend less time with the individuals. So if I've got 10 people and I had no iPads, that's going to take much longer time if I can easily register them, give them the iPad so they can answer questions, and I can serve the next person.
Is it multilingual?
It can be. That wouldn't be probably the issue, I think, to be multilingual. I think the whole purpose is the platform to see if it can be implemented and it can be used correctly.
Yes, I'm not going against what anyone's thinking. I'm just asking.
Questions. Yeah. So
hospitals are
we did start the process of asking, well, what environments would this be used in? So we had discussions about the primary care setting, then we had discussions about the ER. Two very different animals. But yes, it's a solution that could be used in either one, but you would have to develop different workflows. You have to develop a different type of product or functionality for each of the two different environments. And again, two different markets. Which is the one we want to go for? The larger market or the smaller market? Question mark.
And also, our team had also discussed having different packages for different offices. So the leading questions are different for dermatologists and the dentist and the cardiologist, so that obviously you have the basic, do you smoke, do you drink, do you do drugs, and all of those questions. But then in terms of particular specialists, the leading questions are a little different.
Are you guys concerned with that this may be, it seems as though, or it can be used to assist in creating that doctor-patient relationship? However, that's something that I see with technology, it's slowly going out the window even more. Like, how is this going to affect?
We did talk about that in terms of one of the things that this does is it creates, I think, a comfort level by both parties. The patient is more engaged and they feel more comfortable about, they've provided this information. Now, if I'm a doctor and I see you wrote 3 or 4 sentences in the other category, and I read that, and when you come into the office, the doctor is directly responding to that in a way to start the conversation. He's not just starting blind, he's starting from a point where the conversation should start, which is what is their condition, what are their symptoms, rather than going through the motions of going on to the computer and saying, check, check, check. And after 5 minutes, then he gets to actually discuss your issue. So this is a way to engage both parties a little better in the process.
But also, one of my doctors, we have a patient portal, but she still never signs off anything without us personally speaking. So I might put in the portal, hey, my head hurts or something like that, or this is kind of a side effect. Do you think this is a side effect from your prescription? It doesn't substitute the relationship I have with her. She's not going to say, oh, that's cool, I'm just going to call CVS and give you a prescription.
Hold on one second. So, yeah, sorry to cut you. The technology is available to do this with us immediately. How many people are serious about this, pursuing this idea? Because we can have the tech ready very quickly.
Again, I'm serious about this in terms of very quickly. I want to answer more questions before I go ahead and say, let's pull the trigger on this, because there is what we could do. And if we're doing this to gather data to help us launch something bigger, yes, then I'm all in. So that's something that we can talk about.
And I was wondering, would there be a way we can get this into like a one piece of paper, I think like you talked about, or something, So like if we all kind of, because I have a good network of doctors, and my mom, she's a dentist, and she sees a lot of patients.
Fantastic.
So I'll bring this to her today to see her opinion on this. So I just want to maybe get it in, so I can have a better explanation of it, if that makes
Would
sense.
you be interested in doing that?
Sure, I'd be interested in, I'll develop a one page.
Just something, or like a blurb or something small,
Sure,
just
sure,
so
sure.
easy.
Basically, get some market research. He's going to get some market research.
Yeah, because
He's
if
gonna talk to
And from your
patients.
perspective, you've mentioned that some of these pieces were already being done. So if I can get, just who's doing it today, so I can do some more research. You have some ideas of who's doing what.
Basically, we have the technology ready. We have the electronic health record systems ready. And so basically it does everything you're doing except the video component. There's no videos there. We can add videos on that. So apart from that, it's already there, survey based and things like that, pre and post. We don't have the AI. That's something unique, but most of the people already do this. All the Epic does it. It sends forms before and after. And so I don't see much unique value proposition there. So the only thing I see is in a kind of an AI angle.
Well, I guess what I would like to see is who is doing this that already, so that I can just see what their models are. Maybe it can trigger some more ideas. Because if it's really being done out there, I mean,
pretty much every electronic health record system is doing this.
Okay, so you're saying
you
you're
can
saying
start
Epic, Cerner, and all of them are
all the
doing
big
this?
ones, yeah.
I'll
This is an easy one for them to implement. Once they build the electronic record, putting survey forms is not a big deal for them.
And you mentioned ZocDoc, is that right?
ZocDoc, what it does is that it's a centralized reservation. You want to see a doctor, you go to ZocDoc, put your zip code, and it'll tell you who are all the doctors available, and you click a button to reserve.
Yeah, that doesn't sound like it's anything related to this though.
The biggest challenge with you is going to be that most of the what is it, that thing you communicate with your
Patient
doctor?
portal.
I have it.
The patient portals.
The
Yeah.
patient portals right now
Yeah.
do everything
Yeah.
on the phones.
Yeah.
Everything that this does, they
Right.
do it.
Yeah, but not the patient portals that I've interacted with haven't had all of these questions.
They do.
They do now?
The one for my doctor, the Leahy one, you go in, you sit down on the phone, you check in right there. And the nurse receives it and prints it. No more paperwork. That's why I was saying, if there is a way of paperwork is, like I said, extinct. People want to get rid of it. And, offering iPads, it's there. It's already been done. But if we could get a way to have it look maybe different from what some portals right now do, because portals do offer phone apps where you could do all these things, even home check-in. I'm coming in 30 minutes. You check in, you come and sit, and the nurse just tells you, verify whether everything here is still up to date.
Yeah.
But we got something here.
Okay.
Yeah, I see. Forms are forms are not very interactive, but if you can build an interactive kind of engagement. Yeah.
All right.
Cool. All right. Thank you so much.
Thank you.
Yep.
What happened to the other groups?
Yep. So I'll talk about the bed finder, treatment bed finder, and our customer is someone who has an addiction problem, and they're looking for treatment and detox to be done. And that's one customer that is self-checking patients. And another customer is people who are in the hospital, primarily case managers. Is it case managers in the hospital? Who refer patients? Case managers, right?
Case workers, social workers.
Social workers?
Mhm.
Yeah. Another customer is social workers in the hospital. What they do is they want to discharge someone who suffers from addiction. They create a call sheet and they fax it to different detox centers, right?
Yep.
And whoever gets back, that's when they know that there's a bed available. So that's what people do to find a bed. The problem with this is that it's the pain points is that it's not very user friendly to fax. from the hospital side and just wait to hear back from people. And for the problem statement from self-check-in patient is that they have to physically call each and every detox center to see if there is a bed available. So these are the problem statements. And if we fix the problem statements, the gains for the customers would be that they would get detox, they would get the treatment, they'll have a place to stay, and they'll get back on their life. So those are the gains.
Another one is for health insurance. Actually, it's saving a lot of money for health insurance expenditures.
Okay, so saving dollars.
You save a lot of money.
Okay, and so we looked at this, and we looked at it and said, okay, what can we do? So we came up with an idea, IoT solution. It's a dash button which can be put on each and every bed, and we discussed that with Martin, who works in that area, and he said that you cannot have anything in that room, including dash buttons. So that was a bummer for us.
Wait, why?
Huh?
Why can't you have any?
Because they can be considered weapons, but they can use such gadgets to do anything. They can light up, because of the behavior situation. If they get activated, they can do anything. So we try to put everything away from them.
They can hurt themselves or hurt others.
Oh, this is in a detox center.
Yeah.
What's the difference when you go to the mess hall and eat? I could easily slip a fork, spoon, or knife and do anything I want to do with that as well.
What's that?
What's the difference going to the mess hall and eating breakfast, lunch, or dinner? Because you have the option to stay in your room or have it upstairs or go to the mess hall if they have a mess hall.
What they do, so we have a sharp, there are precautions that this patient will not be given a fork to use to eat, or it can be given a spoon, but in the presence of someone. So they're watched, like we watch them 24/7. To make sure there are things that you may not really try to avoid to happen, but you make sure that there are minimal accidents. So it's included. They use batteries, only batteries, to light up something like So they're very smart and creative.
Wow.
Oh, they can even say, just because they're button, they'll just press it. Bed available.
I like that.
And then now there's a whole party in the room.
Yeah, so that's a problem.
Extra? This?
Extra what?
Over there.
This is right here.
Oh, right here. You can have this. You can have this. Okay, so so that is the problem statement. So what we thought about was, okay, if we can't use the IoT solution, then we thought of using an app which can only be used by nursing supervisors. Nursing supervisors make that decision of filling a bed. They are the ones who are responsible for that. So we think that giving them an opportunity, an app, where they can, with few clicks, they can make sure a bed is available, and that'll flag it in our central database, and everyone can watch it from there. The value proposition is that people don't have to call all the places to find if there's a bed. There's a central website they can go to see if there's a bed available, and people don't have to fax. So these are the pain relievers. So this is what we have so far. So pretty much instead of IoT, we chose a QR code system where we will attach a QR code to each and every bed. It could be a paper, or it could just be imprint, and the other problem with that is that traditionally QR codes require an app to be downloaded. People hate that. That's where the adoption was low. But new phones are coming up with inbuilt QR code readers in the camera itself. So we think that after that, the adoption will go very high.
But all of these addicts have a QR.
No, it's not going to be used by the addicts. It's going to be used by the nursing supervisor who's responsible for maintaining the availability of the beds. It's only the supervisors.
So like But on her point, what about tools like patient ping that are focused on a patient discharge? Are they using that for this type of bed identification or not?
No, they're using admission, discharge, and transfer data.
Yeah.
So that's the data you can get when you connect to our electronic medical record systems. We can connect that all the electronic medical record systems, but it's a huge task. Just getting permissions is like the big problem.
All right, so this gets around the
the whole deal of getting
mess
permission.
with getting patient data.
Yeah.
You're focusing on the availability of the bed itself.
Yeah, that's all.
So, to whom it serves, okay, like, you know, I mean, beds usually are turned by what, 11 in the morning, right?
Martin, what time does the vets?
Usually it's 11 in the morning or something.
What time do they turn the vets? 9 in the
To
morning.
clean them?
When do they
When
discharge
it comes turn is to
They can discharge at like 11,
people
11
they're
p.m.
ready. You know,
They do it anytime.
This is discharge.
Yeah.
Okay.
They do it anytime.
Yeah.
Anytime. Because it's 24/7.
Yes.
Okay. So, who is going to be using it? Okay, I know the
Nursing supervisors.
the main nurses, you know, the nurse supervisors. It's great that they know. So they'll be feeding this information to the doctors.
No, they don't have to let the doctors know. So the doctors discharge, and then when they discharge, it's upon the caseworker
So
or
they
social worker.
discharge, so a bed becomes available.
Yes.
Right. So, but I'm saying, so becomes available, gets turned, etc., cleaned up, whatever. So the nurse supervisor gets a notification that a bed is available.
Yes.
Correct. But then isn't it more important to triage rather than the nurse itself? Because the decision to occupy a bed is usually done by need, and need is assessed by triage nurses and doctors. The nurse supervisor just administers what's the flow, what's going on.
Because the doctors, like for example, doctors work different hours, and then at some point you have one doctor. They have to see patients. That's their role. So the nursing supervisor coordinates everything going on. And actually, their major role is to coordinate the admissions.
Exactly. So once the nurse has this information, what does she do with it?
So she will be, if in the app, she'll be the one to put like we have an available bed number 44 for female duodenal diagnosis. And then that's it. Then they will. Then the lesser another communication come in. Okay, with, this patient's A, B, C, D, because they call and tell them like, oh, they have these conditions and all that. So are you willing to take them? They are wheelchair bound, or they are this. So details will come in and say, okay, we can accommodate that, or we cannot accommodate that.
I think it varies from hospital. I mean, from my experience, for writing apps for hospital or be a patient. Sometimes you just stay there waiting until a bed becomes available. Okay, and the doctors already sign up that they want that person to be admitted.
Yes.
You just don't have the bed.
Yes.
So the nurse administrator is just an intermediary.
Yes, but the doctor cannot sign if the bed is not available. If they don't know that at 11 a.m. they're going to discharge someone, so that bed is going to be available to put it like it's available. So they have to know that they're going to have 3 discharges by tomorrow, and then they will admit other 3 people. So they've done it when they have admitted someone new, but the bed is still taken, but the other one is still on the unit. They leave the bed, but they're still in the unit, but they're not allowed to go occupy the bed because they're in the process of leaving.
So who's gonna buy this?
That's a good question.
I can think of one, but go ahead.
State primarily, because it's state is the one who's having the biggest problem.
The biggest problem.
And they're the ones with the least amount of money. Okay, go ahead. But it doesn't matter. You have a set price for it. But you say the state, and I'm thinking, are you going to sell it to the state, or are you going to sell it to the managed care organizations that serve the state, or both?
I don't know, but this is one of my experience. The state itself, the hospitals themselves, they needed this to coordinate, to have an easy way of coordinating, to know where the beds, when they discharge, the first discharge, when they discharge someone to go out. They're going to need detox to find, even though they have this relationship with different partnership with detox centers, but it's much more, way more easier to click and say, oh, there's a bed in here, there's a bed in here, or there's no bed. And then to the end users would be even like those patients who do self-check-in, they'll know that there's a bed here, and then they can take them check out as well. Say, okay,
I got 10 beds, they're available. Your system tells me these 10 beds are available, right? Now, you've got 5 clients. Those 5 clients all see that that bed's available. How do you prevent that, prevent them from taking all the beds? Or
it's not an online reservation.
How do you deal with that?
It's not an online reservation. We'll just tell the bed is available, so people have a call.
So they have to, whoever gets there first gets there first.
Yeah.
Okay. And then it's updated pretty quickly.
When they check it, sometimes it can be available, and then people say, like, the hospital can say, we're sending someone over, and they don't show up until the next day. So you indicated it's filled when the person checks in.
I guess the question is, how much of a, yes, it's a frustration for the health plan or the state to call to figure out whether there's a bed available or not, but how much are they willing to pay to have a new system, another system on top of all the others to solve that problem?
I think, I think you're right. The insurance companies are also one of the customers, because if they don't get treatment, then relapse over and over again, and then they're utilizing the resources. Every time they get checked into ER, it's going to cost a lot, and the insurance companies and the state will be
okay. Well, I mean, it's low cost to develop, so you may not have to charge that much in order to gain a profit.
Frankly, I'm willing to give it away for free as long as we can get into the hospitals. We can sell other things. Getting into the hospital is hard work. Yeah, once we get in there, we can sell so many things. Yeah.
What was there were other sessions too, or did people left early?
No, we just discussed both the things. Yeah, we didn't work on the relapse detection.
Oh, okay. All right.
All right, guys. Unfortunately, we're time up, and it was great having you guys. And I hope to see you again.
All right, we will.
Yeah. So the business cards and everything, can we work on that?
Yeah. You want with that?
We'll set up a time to work on that.
Yeah. Set up a time.
Yeah. All right. Thank you, guys. Have a good night. Hopefully, it was useful to you. Thursday, yes. Yeah, let's quickly go through what you have, and then we'll set the time.
The publication, I think, is from Fierce. You know Fierce?
Oh yeah, I've seen that.
I think they have Fierce.